Good afternoon, everybody. I know we've got potentially 3 new members joining us today to introduce themselves. And I saw Carissa's email about Ludmilla having a proxy. Do we have any other proxies today?
Not that I'm aware of. I think Rebecca Sam is going to be sitting in for Ludmilla until she gets here.
Great, thank you.
I see that Sonoma Council member Agramani has her hand up, but that could be Madeline. I'm sorry, I'm speaking early. It could be you would be seated, I think, at the March meeting, right? Anybody who's been appointed.
Yep.
Happy birthday to someone on here.
Yes, Michael. Happy
Thank you.
birthday.
Happy birthday.
Thank you. I made it to 21.
It looks like we have quorum. I don't know if all 3 of our new members are here. I see 2 of them at least. Not sure about Wida.
Yeah, I've not seen her yet.
All right. Normally I would start, but since we're asking them to introduce themselves, I wonder if we might want to give Wida another minute to join.
Do you think we got the link, the participant link, the panelist link?
I did send it out.
All right, I see
Cheers.
we have quorum and that all of our new members have joined us. So I'll bring the meeting to order. Welcome everybody to our January 26th, 2022 Continuum of Care board meeting. As everyone knows, we use our Zoom webinar format, which provides the greatest security features for public meetings that helps ensure that we create a safe space for our members and partners. We realize it may feel a little bit less inclusive because you can only see board members and staff, but there will be time for public comment on each agenda item, and non-members can raise their hand and will be unmuted to make public comment. We've disabled the chat feature to be in line with Brown Act guidelines. However, if you're having any technical difficulties, please reach out to Madison Murray, and her email address is there on the slide on the screen right now, and she can help troubleshoot any technical issues. We do have 3 new members joining us today. We want to give each of them an opportunity to introduce themselves a little bit. And my apologies, I'm sure I will butcher all of your names, but we'll start with Wida to start, who's going to be representing COTS.
Good afternoon, everyone. My name is Wida Cooper Rodriguez. I'm the new Chief Housing Officer at COTS, and I am very honored and pleased to be here this afternoon and to serve as Chuck's proxy. So a little bit about me. I am a longtime East Bay resident, new to Sonoma County, but not to Northern California. I've spent many decades providing services in marginalized BIPOC communities. And over the last 10 years, I've worked in 5 shelters from California to Delaware to Maryland. I worked as the Director of Programs and Community Engagement and ultimately the Interim Executive Director for Shelter, Transitional Residence, and Affordable Housing Apartment Complex for Women and Children in Los Angeles and several others, including I was a case manager in the shelter. So I'm passionate about providing services to those experiencing homelessness. And this passion comes from my own lived experience, growing up on welfare with a single African-American mother who lived with severe schizophrenia, sexual trauma from incest, and drug and alcohol abuse. She was in and out of mental institutions and we moved a lot. And so I somehow always found myself safe and protected, and my escape was joining the Air Force. I have no regrets about my childhood. Actually, as strange as it may seem, I feel like my mother left me with many gifts, and I'm so grateful for those gifts. The 2 lessons I'd like to share that she taught me. One was to always have a plan A, B, C to Z. And the other was detachment from things, because you can always get more stuff. And so I am just honored to be part of COTS, serving our Sonoma County community members experiencing homelessness and however I can contribute to the CLC. Thank you.
Thank you. Welcome, Wida, and thank you so much for sharing a little bit about your personal history. We appreciate hearing about it. Next, we have Nora joining us from the County Department of Health Services.
That is a hard introduction to follow, Wida. I'm not sure my qualifications are as strong. I am happy to be here. I am also filling in as proxy in Bill Carter's spot for now. So I work for the Department of Health Services. I manage our health policy planning and evaluation team, some of whom you know, Aaliyah and Andrew. And so I've been plugged into this work for quite a while. I pop into these meetings now and again, but I'm happy to be here as a member. Yeah, what else? Also part of, so my background is kind of thinking about social determinants of health, and the intersection obviously of housing and homelessness and health is strong, and we are understanding it better all the time. So also happy to be in this space as a representative of the work that Andrew is now doing, but that started out as our bar high racial equity work, thinking about how we lift up the voices of individuals with lived experience, and which is now kind of manifesting into our LEAP process and board. So really excited to be engaged here and to, again, help kind of just articulate a vision for equity in this work.
Welcome, Nora, and thanks so much for stepping up after Bill's retirement. We appreciate having you here. And then our last new member is Dennis from the city of Petaluma.
Hi, thank you. I'm in my second year on the city council in Petaluma. I also grew up in the East Bay in Richmond. Maybe no one knew about them at that time, but I was introduced, in the fire to the social determinants of health in my first couple of years as a practicing physician. I worked at Kaiser for many years. I'm retired. I did some teaching of public health at UC Davis and become increasingly interested in social determinants of health to the point where I have to say my last few years of practice, I would introduce myself. Someone asked what I did as a junior social worker, because I was trying to learn, because it was easy to see I could help my patients more coming from that aspect. Thanks.
Welcome, Dennis. It's wonderful to have you as part of our board. All right, I think we can move on to a roll call.
Great. Ben Leroy.
Here.
Jenny Lynn Holmes. I see you, Jenny Lynn.
Here, sorry.
Tom Schwedhelm,
Here.
Dennis Posake,
Here.
Chris Corsi,
Here.
Wida Cooper Rodriguez,
Here.
Angela Struckman,
Here.
Nora Melanie Brand,
Here.
Margaret Slike,
Here.
and then I believe we have Rebecca Sam filling in for Ludmilla Bade today
Yes.
as proxy. Are you there, Rebecca?
I am here.
Oh, Rebecca Samet, I'm sorry.
Yeah. I'll be right on in just a sec. I'm still trying to get situated with you guys.
Okay, great, thank you. And Cheyenne McConnell,
Present.
Elena Wall,
Here.
Don Schwartz,
Here.
Stephen Sotomayor,
Here.
Lisa Fatu.
Here.
All right,
All right, thank you, everybody. We'll move on to our first agenda item, which is our consent calendar. The first bullet point here is to approve our agenda for today. Looks like the agenda slide is coming up onto the screen. If there's any emergency items, emergency only, you can raise your hand and we can review whether we want to add any emergency items today. I'm seeing Rebecca has her hand up. I'm wondering if it's to add an emergency item or for something else.
Yeah, it is.
Sure, please.
Ludmilla asked me to talk about my experience over at Palms Inn, which would be separate from the word on the street.
Okay, well, I think we can probably just add that into word on the street without adding an emergency item to do that, but we'd be happy to hear about it.
Okay, yeah, it's up to you guys. Either way.
Thank you very much, Rebecca. I'm not seeing any other hands for emergency items. So I think we can go to public comment on today's agenda. If anyone from the public would like to make comment on this specific, or actually, you know what? Let's move on to the next bullet point here and we'll do public comment for both. Minutes from December 15th. Does anyone have any corrections or edits to the proposed minutes?
Oops, I do.
Yes, please. Elena.
I just, in the minutes, I didn't see it noted that Chuck and I had both raised that we wanted public comment themes to be captured. And so I was just concerned that us bringing that forward wasn't in the minutes, even though we heard feedback from the county that they don't have capacity to support that. I think it's really important that the public has record that COC board members raised that as a concern.
Sure, and that would have gone under the board member question and comment agenda item. Is that correct, Elena?
You know, I'm not sure. I'd have to go back and listen to the recording to know where it fits.
Okay.
I just didn't see it in there anywhere.
Sure. That's my recollection of where it came up, but I could, of course, be wrong. But if staff is okay, we could add that in. You certainly can confirm the correct place to put it, but I think board member question and comment might be the first place to look.
Okay.
Sounds good. Any other suggested edits to the minutes? All right, not seeing any. I think we can go to public comment on the consent calendar, both items, both the approving today's agenda and the minutes from the 12/15 2021 board meeting.
all right, we do have a hand. Andrew, are you able to pull up your timer?
Yeah, I know is with Madeline over here. I know that her hand was up from the beginning, so I'm not sure if that
Okay.
pertains to public comment over this item or not.
Right, I'm gonna go ahead and unmute you, Madeline.
Thank you. Well, I'm unmuted. Oh, great. Thanks. Thank you so much. I just wanted to introduce myself as a new board member. I understand I'm from the city of Sonoma. I'm so excited. I spoke to Dawn yesterday and said, I feel like I'm back in college and I'm in my master's program because I'm doing everything on this board that I love to do. So I was homeless as a child for many years. In fact, I attended 9 schools by high school, and I heard an earlier speaker say, I have great skills with me. I never had my butt kicked once because I had this personality, which is amazing. So, people stayed away from me. I was friendly, but they didn't know what was going on. I've come from the state Senate, US Senate, and I also served on a council in Daly City for 12 years. And now I'm almost into my 8th year in Sonoma on Sonoma City Council. And homelessness, for obvious reasons, is very important to me. Thank you.
Thank you so much. And we definitely look forward to you joining. I believe the new appointed members join in after March 2nd.
Fantastic. Well, it was nice to meet you, Madeline. All right, so I believe we can entertain a motion to approve today's consent calendar. Would anyone like to make that motion, including the one suggested correction to the minutes?
So moved. Stephen
Thank you,
Sotomayor.
Stephen. Do we have a
Second.
All right, I think that was Tom. Thank you, Tom. Any further board discussion on the consent calendar? Not seeing any. I think we can move on to the roll call vote.
All right. Ben Leroy,
Approve?
Jenny Lynn Holmes,
Approve.
Tom Schwedhelm,
Aye.
Dennis Posake,
Abstain, I wasn't at the meeting.
Chris Corsi,
Yes.
Wida Cooper Rodriguez,
I'll also abstain as I was not at the meeting.
Angela Struckman,
Abstain, I was absent.
Nora Maloney Brand,
Same, absent and abstain.
Margaret Slake,
Approve.
Ludmilla Bade, Rebecca Samet,
Abstain.
Cheyenne McConnell,
Approved.
Elena Wall,
Approve.
Don Schwartz,
Approve.
Stephen Sotomayor,
Approve.
Lisa Fatu.
Approve.
Motion passes with 5 abstentions.
All right, thank you, everybody. We can move on to our second agenda item, which is about the new coordinated entry operator recommendation. This is an action item, and Jenny Lynn Holmes and Ty Hilton will be presenting this item.
Thank you. Ty, did you have anything you wanted to say before we get started? Or do we have slides? I can't remember.
I don't think we did make a slide, did we not, Leah?
It's okay. I'm not. I can just go.
No, well, it doesn't, no, I'm sorry, I'm confusing meetings because I've shared so many updates on this. So no slide.
Okay.
But if you want to take the lead, I'll fill in any blanks.
Perfect. So as a reminder, we met, the Coordinated Entry Advisory Committee had, and then we did put out the RFP late last year. And we held a public meeting early in this year. We had 2 applicants. One was the county's IMDT team, and the second was an organization called Home First. We were able to receive some initial applications, did some review as a Coordinated Entry Advisory Committee, had some follow-up questions we asked of the applicants. And then during the public hearing, we were able to ask more in depth and review the answers to the questions that the team had. During that process, the Coordinated Entry Advisory Committee members scored each applicant during that hearing, and we submitted our scores, and we were able to bring forward a recommendation to the Continuum of Care Board here, which is that we move forward with the higher scored applicant, which in this case is Home First, and that we move them forward as our coordinated entry operator so that we can begin the transition for hopefully end of March, kind of complete transition of Home First as the coordinated entry operator. Some of the highlights that the group appreciated out of the Home First application, just to kind of bring those here, is that there was a little bit more neutrality. The conflict of interest was a little cleaner since they are an organization that's new to our community and currently works works outside of our county and is now making some connections, inroads here. The budget was another area of great discussion where we wanted to understand, and it felt a little bit more realistic for the work that was being asked of them. And then lastly, one of the things that there was good discussion about was the data component that was presented, and the thoroughness in the application, and some of the opportunities that we saw with some of the initial work they do in other communities that they work in. I will say I believe we do have a Home First here, or at least representatives of the organization here. So if there are questions of the applicant, we do want to give the opportunity to the board. But I will say that the Coordinated Entry Advisory Committee very well spent a lot of time on the applications, on the scoring, asking questions, and so on and so forth. So that is the recommendation from the Coordinated Entry Advisory Committee. And I'm happy to answer any questions to see if Ty has anything you want to add in. I know several of you are also on that board, on that committee, so please feel free to chime in where I may have oversimplified or not given enough context. But I will also say we are hopeful to make a decision today so that we can actually create a realistic transition plan and get the organization up and running by the time that Catholic Charities will be transitioning out. So I guess if there's anything from other members of the committee or Ty that I may have missed, please chime in. And if not, we can hopefully begin the discussion.
I just really want to thank Jenny Lynn as the chair of the Coordinated Entry Advisory Committee and all the members, both the applicants and of course all the members of the public that came to those meetings and gave public comment. It was a really, I think, well thought out process, and it took a while, but I think it actually proceeded in a really wonderful manner. And I think we finally were able to settle on a really great applicant. So just want to thank everybody that was involved, and Jenny Lynn for getting in and out of those meetings on time. There was a lot of discussion that had to happen. It's a really huge decision that we have to make here, and really appreciate your leadership on that, Jenny Lynn and Ty, for all your support. So thank you, everybody that was involved. And Ty, did you have anything to add before we go to board member questions and comments?
No, Jenny Lynn covered it very well, but I'm here if others have questions.
Sure. Wida.
Thank you. I am wondering what the total budget is for that, since I was not involved at that time.
Yeah, I'll do it off the top of my head, and Ty, correct me if I'm wrong. So right now our budget for it is around $3. There is a gap. So there is a gap, just a funding discussion we need to have, right? It was, both of the applicants came in over what we currently have allocated for it. Catholic Charities is currently the operator. I think it's about $370,000 that our current contract is for. Home First came in a little over 500,000. And again, I don't have the correct direct numbers in my head, but they all, like I mentioned, Home First is on the in the public, and we can hopefully move them over to panelists if there's any direct questions on them. But that's my high level budget recommendation or remembrance.
Yeah, I believe the COC funding for coordinated entry is about 350,000, and I believe the Home First budget came in at about 525,000, about $175,000 gap. And if the county proposal, IMDT proposal, was I think closer to 1.1 million, so a much larger gap. But I think Dave and some other CDC staff may be able to address some of those budget questions. But if there's other non-budget questions about this process, please let's ask those now, and then we'll maybe tackle the budget issue. Supervisor Corsi?
Thanks. I had questions for Home First, if they're available.
Yeah, let me move them over.
And I think, to be fair, I think also members IMDT, potentially Joe Hegedus, are here too, in case there were questions for County IMDT as well, just to have both applicants available.
Oh, great. Thank you. I didn't notice that. That's great that they're both here.
I am not seeing.
If you're on the home, if you're Home First or from IMDT.
Oh, there they are.
There you go. Raise their hands, maybe.
Yes. Yep. Okay. Renee, you should be moved over. Are you over here?
Hello, everyone.
Hello.
Hello, Mr. Ramirez. Chris Corsi, member of the Continuum of Care Board. I was curious in reading through the question and answers about Home First's kind of aspirations, I guess, in Sonoma County. I know that you're involved with the Roanoke Park and their Home Key project. You're hoping to be involved in this, but can you share what other ideas you have for your organization's involvement in Sonoma County for the future?
Sure. So if you're not familiar with Home First, our agency's been around for 40 plus years, serving primarily Santa Clara County a project or two slightly outside of the county. But we've made significant headway over the past several years and have begun to be seeked out for support in other parts of California. So over the past, I would say the past year or so, we've tried to take a more strategic approach as to how we expand if we decide to move outside of Santa Clara County. And Sonoma County is a space in which City of Rohnert Park reached out to us for that Home Key project. So as we started to dig into this community and made some connection with folks like Jenny Lynn and folks at the City of Rohnert Park, we learned that at least it feels like there's a bit of a need in terms of additional service providers. And so it feels like a good match for us in what we've done thus far as an agency and what we're hoping to do moving forward, which is take some leadership roles like the CE provider opportunity, looking at things like that EIH, which is a direct service project, but also it's one of the more innovative projects and something that we actually took lead in through the state of California. We're the first provider to operate a modular unit type of project in the state of California. So we're looking for those types of opportunities. We are trying to take a bit of a slower approach. We've had some conversations with other providers out there. We're not wanting to take on too much, especially if we step into this coordinated entry project. And we understand that there's been concern with conflict of interest between, being a CE provider and being a housing provider as well. So we're wanting to get to better know the community. We are wanting to establish a physical office out there. And hopefully once we make some good connections and if the community is welcoming and we're building good partnerships with other providers, we'll look at other opportunities there. But in short, I know that was a very long answer, but in short, we are wanting to establish a presence, a physical presence, not just in Rohnert Park, but across the county.
Thanks, and I appreciate the additional information. That wasn't too long of an answer. Maybe this one will be a little shorter, but I want to ask the county about their proposal also, which was twice at least the amount that yours is. I'll ask them why theirs was so high. I'm asking you why yours is half of what theirs is, and if you're confident that the amount you're proposing is adequate to do this work, and that we won't be sitting here a year from now with you looking for $1 million.
Sure. Now, so I think there's two items. One is that, I think in my experience, a government agency is always going to be more expensive than a nonprofit. That's probably the biggest difference. But if I recall, the county was also proposing to offer some direct service in either a clinical way, or they had some clinical staff assigned to their budget. And I believe they were trying to carry out some direct service outreach activity as well, which may have bumped up their budget. But that's, based off memory. But I would think ultimately,
and I'm not asking you to defend theirs.
I'm not. I think I'm just trying to point out the differences in the two budgets. But I think ultimately it's that we're a nonprofit, and I think we're always going to operate at a lower cost than a government agency.
And the question about the confidence of your numbers there.
Well, we feel really confident in doing the work as we proposed it with the budget that we've put out. We're definitely open to conversation around what that scope actually will look like moving forward. And if that means that we either trim down our budgets to match or potentially increase budget to match, things that are not within our proposed scope. But in speaking with Jenny Lynn, I mean, I think I have a solid understanding of the work that Catholic Charities has been doing, and picking up where they left off and building upon the strengths that they've put out. I'm confident that we can do that with the budget that we proposed.
Okay, thanks, Mr. Ramirez.
Sure.
And then Supervisor Corsi, did you want to ask a similar question of the county IMDT as well?
If Don has a question for Home First, let's stay here for a minute, and
Okay.
we can come back to IMDT later on.
Okay, so I think we can confirm that the Joe H and the attendees is Joe Hegedus, and can certainly promote him to be a panelist to answer questions if that's indeed Joe Hegedus. Go ahead, Don.
Thank you. And first, thanks to Ty and the committee for staying with us and going through 2 RFPs. That is not a light lift. So thank you to all who did that. And Renee, you and I met a couple months ago when we were talking about coming into Roanoke Park, and we're delighted to have you coming. And I will tell folks, we did some very deep due diligence on our options for providers for our home key site, and we're very pleased that Home First is going to be partnering with us. And so far, everything we've seen has been thumbs up. So that's good news. I had a couple questions that perhaps they're for Home First, but they might overlap with staff as well. I guess for Home First, for Renee, do you have room in your budget, in your capacity, to participate in conversations we're having here outside of the COC board around systems improvement? And one example of that is we're on the Built for Zero team, so to speak. We're one of their clients. That work, I think, is getting some legs with Ty's leadership. And I think that having you be part of those conversations along with the other providers would be really important to ensure we get a coordinated system of care. So does your budget and time include opportunity to participate in those sorts of efforts?
Yeah, absolutely. Whether it's within the budget for this particular project or not, as coming into the city of Roanoke Park as a provider, as mentioned earlier, we want to also do our part within the community. And if that means that, either myself or someone from our leadership is participating in other efforts across the county, we're happy to do that.
Thank you. Related to that and talking about the system, I know this isn't an item in this point in the agenda, but it's coming a little bit later this afternoon. But I'm curious about your thoughts on 2 things. One is case conferencing and the nexus with the by names list. You referred to that in your proposal. We're a fragmented system here with about 5 different case conferencing efforts underway. It's kind of fragmented in many other ways, but that's one of them. And the second is we're going to be talking later today about centralizing some of our housing locator services with a real estate professional. But to me, there's potentially a natural nexus between having the coordinated entry provider also be the one who manages the case conferencing process and the by names list, which I saw was in your proposal, something you'd be willing to take ownership of, as well as the housing location function, although presumably you would need real estate professional running that for you. But I'm curious, in terms of your experience with other systems, if you think it makes some sense to kind of keep you in mind if we're looking to add that to your plate. And obviously we need to accommodate budget accordingly, but your thoughts.
Sure. I think within the proposal that we submitted, we speak quite a bit around case conferencing and the importance of it. That's going to be central to our proposed matchmaking. And we understand that there's a bit of a fragmented system, and you've got different case conferencing opportunities out there. And even with that, our thought is that we want to be able to support those efforts, right? Understanding that the initial case conferencing happens with the CE provider, but once those matches are made, and if there are case conferencing activity happening by service type or by region or whatever that might be, we want to be a support of that and even participate in those case conferencing efforts if we're welcome to. And secondly, yes, I mean we'd be definitely interested in talking more about other opportunities there.
Okay, good. Thank you. There's one other comment on the proposal and then some questions maybe for staff if we want to go there. One is just a comment that one of the themes that some of us have been singing on this board have been the use of data to help make decisions on funding and systems improvements. And I'm enough of a nerd that I got really excited reading your proposal when I saw how much you use data, how frequently you use it to track how you're doing and to help inform and make adjustments in pretty quick order. So that's one of the things that gives me great confidence in and great pleasure that you'll be joining the Continuum of Services here in Sonoma County.
Appreciate that.
And then I have some questions for staff, but I don't, if you want to, Supervisor Corsi wants to go to the IMDT folks first. I'm pleased to defer to him or others at this point on that.
Sure. Have we confirmed that the Joe H is indeed Joe Hegedus?
I'm pretty sure it is. He normally comes under that name. Yeah.
Just raised his hand.
Cool.
I will
So, yeah,
go ahead.
Let's have Joe become a panelist and then let Supervisor Corsi ask his question.
Joe should be moving over virtually right now.
Hello, can you hear me?
Hello, Joe. Chris
Hi.
Corsi here. I hope you're not driving.
I've pulled over.
Excellent. So if you've been listening, we've been talking to Home First about their proposal. Wanted to ask about the county's proposal and maybe if you could explain. Well, it's obvious that it's different in price, but what's the actual difference? Why is it double what Home First is? And is it double the service, or do you actually think that that providing the same service at the county level would cost twice as much?
Sure, yeah. I will opine as best I can without documents in front of me, but yeah, in short, I think, there's the cost of the staff positions. The most kind of base level staff position that we proposed had I think a total cost of around $150,000, $160,000 a year, which is the standard county cost for that role at the job class that we were proposing. So that cost of employment for the county is part of the factor. I think the other piece of it is that the IMDT was proposing staffing, several access points or sites throughout the county in person, which I think, was reflected in the budget and just the staffing model that was proposed, the level of staffing, et cetera. So I think it's a combination of those factors, both the service and what was proposed therein in terms of having staff at different access points and just the number of staff and the cost therein.
All right. I think the way that Renee put it was that government is more expensive than nonprofit. That's obviously part of it, but thanks for that additional explanation.
Sure.
All right. Do we have any other board questions for the applicants before we get to Don's questions of staff? All right, not seeing any. Don, why don't you ask your questions of staff? Sorry, Don, you're still muted.
That is so 2021. I'm sorry. So for whomever's appropriate, I'm wondering about the funding gap, and maybe this is something I'm happy to hold off if Dave is going to address this. But my question is this: if the county was willing to spend 1.1 or 2 million or something for this function, if they provided it, would they, out of the federal and state money that funds IMDT, at least that's my understanding of what the primary funding source is, maybe I think Measure O might be part of it as well. And I know there's a funding gap here. Would the county be willing to use some of those same dollars for the same function, even if it's operated by someone else? Or does it have to be you only spend dollars on programs that you operate directly?
Hi, Don and board members. I don't think I can answer that question yet. That's a conversation I need to have with the county administrator. I did encourage Jenny Lynn and Ty and the committee to seek out what they feel is the best provider, not regardless of cost, but that cost is not an inhibitor to that decision. And I think they've done that. I participated in the presentations by the teams. I thought they were both good. I'm respectful of the committee's decision, and I do think we'll be able to successfully address the funding gap.
Thank you. Then I have a couple other mechanical, well, semi-mechanical type questions. One is, we don't have the contract itself before us, and I'm used to, as a, for our city council, for example, and other boards I've been on, the contracts themselves come before the governing body. I understand particularly if the county's putting in additional money into this that's not under the COC's control, it might need to go to the Board of Supervisors. We removed the piece from the charter that, is my understanding, prevented us from being able to approve contracts. So is this something that we will actually approve? Is it something that you want us to delegate authority to staff to sign the contract? Does it need to go to the Board of Supervisors? Can you explain what the process is from here on that?
Dave, do you want me to take that one or do you want? Yeah, so Don, I think it'd have to be the operator has to be approved by the COC board, but then if it goes into the way, since the HUD COC grant, it goes into the COC's budget. So we just have to get budget authority to spend the money, but it has to be approved by the COC board first, but it would have to go for a simple budget authority to be in our budget to subcontract.
Does going through that simple budget authority mean you have to go to the Board of Supervisors?
Yeah, for a consent item, just to have that, the ability to spend that money in next year's budget, even if it's being subcontracted.
Okay, thank you. I'm not quite sure I would understand or agree with that, but that's fine for the moment. In terms of the scope of the contract, because we don't have it in front of us and the timing, I would, it's a 3-year contract as I understand it. What I would hope is that we might include the option for, say, 3 one-year renewals upon mutual agreement or something like that. So that if we're happy with them and they're happy with us, and we can maybe amend the budget after 3 years, we don't have to go out and do another procurement, which can be very time consuming and require a lot of effort. Is there any thought to including a provision that would allow for renewals for, and again, it's only if they're performing well. There's no obligation on our part, but if we're happy with them, that allows us to continue.
I could, yeah, just this is again, there's a unique aspect to the main HUD grant. Now, if we get other funds for it, that would be different, but the main HUD grant goes from April 1st to March 30th. So the funds actually could be it's off cycle, even though we put it into a 7/1 to 6/30 contract, but it has to be renewed annually every year under the COC board. So you could certainly do a 3-year, but it still has to be approved. It can be automatically approved each year in the COC competition. If that makes sense when that comes out.
What I'm asking is that there's a contract term in this, right? In the contract that says for 3 years.
Yeah, we could, I think that was what it was. We could do that. Yeah.
So what I'm asking is, could we amend that language to say 3 years, renewable for up to 3 additional years upon mutual consent, funding, pending funding availability. So we don't have to do another procurement in 3 years.
I don't have any concerns about it.
I don't either.
If that's the recommendation of the COC board.
Yeah.
I'd like to include that with any motion to approve this this proposal. And the other thing I'm hoping we can include is the option to add affiliated or related or other services. So for example, if we do want to proceed with a centralized housing locator, somebody goes out and finds housing for us, an item later on our agenda, we can add that to this scope of work with simplicity, as opposed to whatever we can do to make that as simple as possible. Another example is if we want them to manage the by names list or something along those lines. I hope we can include a clause that makes expanding this scope easy on us if they're agreeable to it and if we think it's in our best interest as well.
Well, I would think that's a simple contract amendment either way, whether there's language that authorizes the contract amendment or it's silent on that. Off the top of my head, I think we agendized this specific to coordinated entry. So Anyway, I don't think it's a problem to amend the contract later. I don't know that, I think it might be a problem to amend it now to say you might add things such as when we weren't noticed that way.
Okay, fair enough. Thank you.
Okay.
That's all I have. Thank you.
All right, thank you, Don and staff. I do have one question for staff. It's pretty simple. I believe in the past, it was the county CDC was actually listed as the grantee for the coordinated entry, and then it was subcontracted out to Catholic Charities. I was just wondering, is that the plan going forward, that the CDC will still be kind of the grantee subcontracting out to the selected applicant, or will the selected applicant actually be listed as the grantee?
It would have to remain with the CDC until the next competition, the HUD competition, which would be in July, August. At that point, we could ask about changing it, but at least until then, for this year coming up, actually, it's already been submitted in contract with the COC as the grantee, or sorry, CDC is the grantee and Catholic Charities as the sub. But when we get the contract back from HUD, probably in the next 6 to 8 weeks, we can change the sub grantee out.
And I don't have an opinion, so I didn't mean to make it sound like I care one way or the other. I just, I'm curious maybe if it makes it easier one way or the other, if they're just subcontracting to just continue renewals and things like that, versus if they were the grantee themselves, if there's more regulation and rules around compliance of those kind of options.
Carissa and I would have to, it would have to be actually a complete switch. So it could be done, but we would have to communicate with HUD, with our CPD rep at HUD in Region 9 on the mechanics of that. If there was a desire to switch it and have it directly to the grantee without the CDC in the middle. And also I wanted to point out too, just before I forget, in terms of funds, in the annual COC competition, your board will have the option, as you did last year and other years, to reallocate funds from underperforming projects. And that's how we got coordinated entry from 108,000 to 349,000 in 2016 by taking away about 250,000 from projects that were underperforming and putting in. So regardless of other funds that might come before then, you will have an opportunity probably next, September, October, to potentially add funds for next year, not this year.
Sure. So I would just ask staff maybe if you could research the models, right, for this, whether it's best to maybe have CDC as the grantee subcontracting like it's been in the past, or better to have the applicant as just like Don's saying. And I think the easiest thing for us is just to be able to extend the contract as we like. And if that's easier having them as a subcontractor to the CDC, then we could continue that model. If it's the same either way, we could, as a board, decide to do something else. All right, I'm not seeing any other board hands on this item, so I think we can go to public comment. If anyone from the public would like to comment on this coordinated entry operator item, which I know is a very important one to our community, please raise your hand and staff will unmute you and alert you when it's your turn to speak.
All right, we do have a hand. Give Andrew a minute to pull up the timer. Jaya, I'm going to go ahead and unmute you.
Hi, I have a question. I'm not quite sure if there's an agency involved that can help me. Is there a program or agency that would support the edge of homelessness, meaning I'm on a fixed income, permanently disabled and homebound, and my rent has increased another 10% as it has every year since I've been here, except for 2020 when it was held off. But then I have another one coming, and I had some help this last year where I was from CAP that helped me so I could put some money away to help that 10%. Well, that's going to run out about the same time my next 10% rent increase is going to come. So I'm looking for an agency or somebody that can help me. I'm on waiting list for the City of Santa Rosa's voucher program. I've been on that for many years. And then I just missed the lottery for I didn't miss it. I applied for it, but didn't get chosen on the lottery for Sonoma County. So anyways, I'm looking for a program that can help me navigate through this financial, I'm just at my limit is what it is. And the only place is going to be to go homeless. So the prevention of homeless, I guess I'm looking for.
Thank you. Next, we have Jennifer. Andrew, can you put it, there we go. Jennifer H., you're unmuted.
Hi, everyone. My name is Jennifer Hart. I'm the Homeless Outreach Coordinator with the District Attorney's Homeless Outreach Team. And I just kind of had a question as far as communication around the transition of the operator. I know obviously there'll be communications with Catholic Charities on that transition there, but as far as the agencies that partner for access points for coordinated entry, when we might be connected as far as communication around that so that service delivery for clients can be as smooth as possible. I know already it seems like there might be some bumps in the road. So just as someone who, does coordinated entry intakes for clients, I just wanted to know what that communication timeline might look like so that we can, make sure that no one falls through the cracks during that. Thank you.
Thank you. I'm not seeing any additional hands.
Thank you, everybody. First, I don't know if anyone can answer Gia's question about where she may go as a first access point to basically, it sounds like seeking rental assistance.
Gia, if you're still listening, you're welcome to contact us at the CDC and we can make sure that your eligibility for rental assistance is evaluated. So we don't have a chat here, but if you could send me an email, we'll follow up on that with you. I'm on the county CDC website.
And Gia, you can also do with me too, if you can't.
Yes.
Sometimes a little easier to find. We will definitely get back to you this week. There's several options.
All right, thank you guys for doing that. And then, I don't know, Jenny Lynn, if you, as Catholic Charities of the current operator, maybe had an idea for a communication plan with our existing access points.
Yeah, we haven't thought that far yet. We wanted to get the new operator. All of our focus has been on getting the new operator chosen and selected. So we definitely, as soon as that is official, start setting up meetings to be able to do the transition and the communication. I will say all of this is openly discussed in our coordinated entry advisory committee, and I would assume will continue to be publicly discussed there. So we definitely would love any and all participation by organizations and community members that want to get more specific on the coordinated entry component there.
Thank you. And well, I'm sure there may be some bumps in the road, as the commenter said, that there will be communication, about the transition to all the current access points to try to make it as smooth as possible, given the challenges that I'm sure are inherent in such a transition. I don't know, Don, if you wanted to make a motion that included your idea for the extensions to the contract.
Thought you'd never ask, Ben. Yeah, I'd like to move that we approve Home First as the coordinated entry provider for the continuum of care, adding an option for 3 one-year renewals, funding availability and mutual agreement.
Great. So it sounds like you're suggesting, right, the initial contract is 3 years plus 3 additional one-year renewals at the COC's option for a total.
Mutual option. They have to like us enough to want to keep dancing with us too, but yeah.
Yeah, absolutely. All right, great. Just wanted to clarify. Do we have a second?
I'll second it.
Thank you, Tom. Any other further board discussion before we go to roll call? Not seeing any hands. I think we can move on to roll call. Thank you.
All right, Ben Leroy.
Approve.
Jenny Lynn Holmes.
Approve.
Tom Schwedhelm.
Aye.
Dennis Posake.
Approve.
Chris Coursey.
Yes.
Wida Cooper Rodriguez.
Approve.
Angela Struckman.
Approve.
Nora Maloney Brand.
Approve.
Margaret Slyke.
Approve.
Rebecca Semmett.
Approve.
Cheyenne McConnell.
Approve.
Elena Wall.
Approve.
Don Schwartz.
Approve.
Stephen Sotomayor.
Approve.
Lisa Fatu.
Approve very happily.
Okay, motion passes.
Thank you, everybody. We can all pop our non-alcoholic apple cider right now. It's a huge, huge, huge milestone for us. And I just want to thank Catholic Charities for all their work taking on coordinated entry all these years, and for all their willingness to extend their contracts and have the smooth transition that we are having now. So thank you guys so much for that. We will now move on to our next agenda item, which is agenda item number 3. It's the Emergency Solutions Grant Coronavirus Update and Actions. And I believe first Chuck Modern will be giving an update about the Sebastopol RV parking project.
Yeah, real brief update. The Snow Applied Village Services has entered into a contract with us. They're currently clearing some administrative hurdles and expect to be starting project no later, getting clients on board no later than about February 15th.
Thank you, Chuck. Are there any board member questions, Don?
I have one question, Chuck, and I'm not sure I understand the story correctly, but do you know if they received additional money from the city of Sebastopol for this project in the timeline that we were talking about? And if so,
they did receive an additional 80,000, and that's, so we have to spend the ESGCV money by the end of June, and so that 80,000 will go into the project for the period in next fiscal year.
okay, good. Thank you for that clarification. Appreciate it.
You're welcome.
All right. And I believe now Dave will be talking about recommendations for remaining ESG-CV funds.
So in your staff report, we have a discussion that is a summary of the ESG-CV committee's recommendations. As you know, the committee met just a short time ago. They gave us a list of priorities, and those priorities were centered first around housing navigation, housing location, risk remediation for housing. There's also trying to address those shelters that had impacts due to the Omicron spike that's certainly been taking up a lot of resources recently. We talked about addressing shortfalls in programs with SAY and with IFSN. And they're also an opportunity for a modest winter shelter, winter warming, cooling center program. So these priorities were listed.
Looks like they want to give us $56,000. So that's, I'm not on mute. Sorry.
That's all right. So the committee said, propose something back to the board with these priorities. We focused, as you can see in the staff report, on a couple of different sources of funds, which could achieve a lot of the goals of the committee. But for the COC's ESG-CV, we're proposing that all of those resources go to SAY to continue their program that had a shortfall, which is oriented towards housing and housing placement. And if Lisa had a comment now to make about that, she could. I'd also
absolutely not. I'm totally fine, family.
I'd also welcome Michael or other staff's comments about this recommendation.
I also think that we probably need to do recusals for this.
Once we get to,
Once we get to any sort of decision.
So if we're ready for discussion, or the recusal.
The only thing I would add, Dave, I think Dave hit it all. Just that, again, we still have some federal ESG-CV that we're working through that we could certainly utilize for things like more rapid rehousing and some of the other items Dave listed. So we'll have still working through some plans on that between Dave, Kathleen Kane, and I, and others. So.
All right, so it sounds like before we go to board member questions, we should probably go through the recusal process. Does that sound right?
Yep. All right. I will move you over, Lisa.
Is there anybody else, Aaliyah, that needs to recuse based on?
Not that I am aware of, but go ahead and raise your hand if you think there's any conflict. All right.
All right. Yes,
Margaret, is that?
Well, I would think that anyone eligible for this money would need to recuse, and Reach for Home would be eligible, I would assume. So I need to recuse.
Okay.
Yeah, I think it's a good question, Leah. Should we be saying that any organization that, if you're affiliated with an organization that's received a prior allocation of ESG CV, should be recusing, even if you're not necessarily being recommended for funding during this action item?
That would, and just so folks, I can just clarify who on the board has received prior allocation. That would be Catholic Charities, City of Santa Rosa, Reach for Home, SAY, COTS.
Yeah, so that's a number of us who would need to recuse. So should we all be doing that now? And then
We
need to,
haven't had to do that in the past when we've had this conversation if you weren't currently being recommended. But
That's how we've operated in the past, right, Jenny Lynn?
I'm sorry, Leah, you're saying we've asked people to recuse and if they weren't being recommended?
We did not ask them to recuse if they weren't currently being recommended.
Yeah, I think the only time a conflict could come in place is if you start advocating for a different recommendation for your own organization, in which case that would certainly be a conflict and we would want you to recuse. So I'm perfectly fine us following past practice, which would be not asking those members to recuse at this point in time.
Okay.
All right. Do we have board questions about this item? Board comments? All right, I'm actually not seeing any hands. That is amazing. I guess that means we can go straight to public comment on this item. If anyone from the public would like to comment on the Emergency Solutions Grant coronavirus updates and actions, please raise your hand and staff will unmute you and alert you when it's your turn to speak.
I am not seeing any hands.
Wow, I guess everyone's still on a high from the coordinated entry operator decision. We'll bring it back. Oh, good, Don. That's a bit more on brand, please.
Thank you, Ben. So a couple of comments, I guess. I was pleased to see on the second recommended action, this notion of recommending, the COC board would recommend to the county how they might use some of their federal ESG dollars. To me, it resonates with the theme that we've been talking about for quite some time about blending funding and thinking about it holistically, as opposed to independent buckets. And so I just want to thank staff for continuing to reflect that thinking in what you're bringing forward to us. A second thing I wanted to comment on, and that is around IFSN's interest in supplementing their rapid rehousing program. If there's dollars available for that, I don't have a particular problem with that, but what I wish we had is data that told us, is IFSN a good investment of these dollars? Do they do a good job with what they have now? How do they do compared to other providers? And since, it's just sort of, I guess, whining in a way that we don't have data that allows us to evaluate the performance of our providers is really a significant problem for us in decision-making. We're flying blind, and well, I'm glad to see the holistic funding approach. This is an example of where using data to make decisions would really be helpful. And my understanding is the data necessary for that analysis already exists, which makes it even a little bit more frustrating. So I know we're making progress there, but I just want to point out this is a really good example of where it would be good to have data as opposed to kind of happenstance hearing about IFSN's interests. Thank you.
Thanks, Don. All right, I'm not seeing any other board hands. I think that means we can actually entertain a motion. Would anyone like to make a motion? Or Margaret, did you have a question or are you trying to make a motion?
No, I just have a comment, I can take this offline, but Reach for Home actually has HUD funding for rapid rehousing deposits that we're not able to spend. So just putting it out there that if anyone else needs money for deposits and it's rapid rehousing, we can help you get that money. So just putting that out there, because that looks like that's what this is for.
That's great. Thank you for putting that out there, Margaret. I'm sure there are people who could make use of that.
And if, just as a staff comment, Margaret, if anybody is interested, if you could let Chris and I know so that we can loop in and make sure we're following all the HUD stuff with it.
Fantastic. All right, I'm not seeing any other board hands. So if someone would like to make a motion.
Ben, I can make a motion if you'd like.
Yes, please.
Okay, I make a motion that we, the remaining amount, approximately $56,859 of unallocated ESG CV funds be allocated to social advocates for youth to cover a funding shortfall in SAY's rapid rehousing program.
Thank you, Don. Do we have a second?
I'll second that.
I'll take Elena's second on that one. Any further board discussion? All right, not seeing any hands. I think we can move forward with the roll call vote.
All right, Ben Leroy,
Approve?
Jenny Lynn Holmes,
Approve.
Tom Schwedhelm,
Aye.
Dennis Posake,
Yes.
Chris Coursey,
Yes.
Wida Cooper Rodriguez,
Approve.
Angela Struckman,
Approve.
Nora Maloney Brand.
I approve, and I just want to note that I saw Rebecca's hand go up, so I don't know if she had a question, or maybe it was just not to call you out, Rebecca, but I saw your hand go up there quickly. And
Yeah, I think this was where Ludmila wanted me to ask for about 20,000 of it set aside for emergency warming and cooling stations. So I don't know who would operate it, but maybe with it going to SAY, maybe not all of it, put some of it aside for, or have it be able to be allocated for that purpose.
Thank you, Rebecca. I think we just need to proceed with our roll call vote.
All right, Margaret Slike,
Approve.
Rebecca Samet,
No.
Cheyenne McConnell,
Approved.
Elena Wall,
Approve.
Don Schwartz,
Approve.
Steven Sotomayor,
Approve.
Lisa Fatu.
I think she's recused.
Oh, sorry. All right, motion passes with 1 opposition.
All right, thank you, everybody. We'll move on to our 4th agenda item, which is the Sonoma County Human Services Department presentation on older adult housing needs. And it looks like we have a few different folks presenting today. I'm seeing Sharon Roppert, the Director of the California State Policy Corporation for Supportive Housing, Nadia Woodcock, the Program Development Manager for Sonoma County Adult Protective Services, Esther, I'm sure I'm going to mispronounce this, but Esther Lemus, Supervising Attorney, Legal Aid of Sonoma County, and Ronit Rubinoff, also Executive Director from Legal Aid of Sonoma County. Welcome, everybody. Would one
Thank
of you
you.
like to kick off? Go for it.
I think I'm the first one to talk, and I think we're going to be giving you a presentation about older adult homelessness. So I can share my screen if that's helpful for people to see slides that I'm presenting.
Yes, please.
Okay. Can everybody see the slides? Okay, great. So hi, everybody. I'm Sharon Report, and I work on state policy around homelessness for the Corporation for Supportive Housing. We're a national nonprofit. We're also a community development financial institution, which just means we give loans and grants to create housing opportunities for people experiencing homelessness. We've been around 30 years. Our anniversary was last year. And I've been working on state policy around homelessness for about 15 years. And so I'm just gonna share some basic statistics and information about older adults. We know from data that our homeless population is aging. So 40 years ago or so, when homelessness really first started becoming a big phenomenon in the United States, our homeless population was a lot younger. We saw a lot of 18 to 30-year-olds. And that's where most of the most of the people were, in that age cohort. But for every decade that we've had homelessness, our population has aged. And so now we see that the average age of an adult experiencing homelessness is over 50. And so it's, as you can see from this graph, which was put together by Dennis Culhane, the University of Pennsylvania, we do expect that people experiencing homelessness will continue to be aging and on average have a higher age category. What we know from what that means is that we know that more people are becoming homeless at age 50 or older than ever before. And people who have been chronically homeless, who have been homeless a long time, are aging much faster than people who are 20, 30 years their senior but housed. So there is one saying that a researcher out of University of California, San Francisco, has said, Margot Cashel, she said 50 is the new 75 when it comes to somebody who's homeless. And just meaning, you know, now that I'm in my 50s, I'd like to think 75 is the new 50. But when we talk about people experiencing homelessness, we know they age much faster when they're on the streets. And so somebody who's 50 is actually experiencing the same physical and behavioral health characteristics of somebody who's 75. So they may suffer many more cognitive deficits, and physically they are much more likely to have chronic conditions consistent with an older adult, much older adult than their chronological age. We also know homelessness in general is an institutional circuit, meaning if you're homeless long enough, you're likely to cycle through hospitalizations, much more likely to end up in a nursing home, and you're much more likely to be incarcerated than somebody who's housed. So you go through the kind of that institutional circuit lots of times of going from the streets or shelter to an institutional setting. And unfortunately, our healthcare and incarceration and other justice system and other systems are not designed to effectively discharge people who have been homelessness into housing. They instead are discharging people back into the streets. So that's why we see that institutional circuit. And this is certainly true for older adults, even more true for people over 50 who have had chronic health conditions, again, much more likely to end up in nursing homes and without sometimes the care that they need to be able to access housing that's independent. So generally what we have recommended is really looking at pairing housing that's affordable to somebody who's older and living in extreme poverty and homelessness, along with the services that older adults typically need at a higher chronological age than maybe what that person is, where that person is. So for example, looking at some Medi-Cal funded programs like the Program for All-Inclusive Care for the Elderly that are providing really intensive services along with whatever medical care that that individual needs in order to stay stably housed in an independent setting. Assisted living waiver that is paired with what they call publicly subsidized housing that offers help with personal care needs or cognitive needs or palliative care. Medicaid, home and community-based alternatives waiver, again, for people who otherwise might end up in a nursing home but could live independently with the right level of services, and those being pretty intensive services and services that people who are younger and have been homeless may not need. So that's generally what we've been looking at as around state policy is how do we make these Medi-Cal programs more adaptable to providing these services in housing? How do we change the way they're administered so that they can more easily be connected to people experiencing homelessness? And how do we get the housing systems to embrace and incorporate those Medi-Cal funded services in housing programs that the state is funding? So that's kind of where we're focused right now as an organization. We are leading a coalition of about 20 organizations across the state that include aging entities, service providers, housing providers, homeless advocates, really trying to pursue a range of policy options that would make housing and services more accessible to older adults experiencing homelessness. And I'll just touch on this slide really quickly. CSH across the country has generally promoted looking at a group of people experiencing homelessness and really paying attention to data, using that data to scale up best practices and also sometimes to make sure that we are accurately dedicating resources to those who are most vulnerable and most need those resources. So I'd be happy to share more about that for anybody who's interested in this slide, but we have a whole host of programs that we can point to across the country, as these are really good best practices and models and communities that we've worked with across the country, and be happy to again share more about that when there's a little bit more time for you to hear about it. Thank you very much, and I'll turn it back over to the next presenter on this topic.
I think that's legal aid, if I'm not mistaken.
Hi.
Okay. Hi.
Hi. I think I was set to go, but you can certainly.
Oh, Nadia, go.
All right.
I expected you to start us off before Sharon.
There were technical issues, so my apologies for that.
That's no problem. That's why I was thinking of next. So please go. I was expecting you actually.
I'm sorry, Nadia.
All right. So I'm just go ahead and share my screen. Give me a moment here. All right. Are you seeing my screen?
Yes, thank you.
Sorry,
now it's off.
My apologies. I got a little bit off kilter with the issue that we're having. So my apologies. Just give me one moment.
I'm sorry if I threw you off there, Nadia.
Oh no, it's
probably jumped the gun.
Totally fine. I know your time is precious. So let me just get this together here. All right. Okay. There we go. Are you seeing my screen now?
Yes.
All right. Thank you. So I thank you so much, Sharon. I represent Adult Protective Services. I am the program manager for Adult Protective Services, and let me just go right ahead. There we go. So our programs over the years, APS programs around the state have seen an increase in older adults facing the risk of homelessness or becoming homeless as a result of abuse, neglect, or self-neglect. And historically, our work in APS around housing was very limited because we didn't have the resources or the expertise in this area. In response to this, Assembly Bill 1811 was passed in 2018 and established the Home Safe pilot program. 25 counties participated in this pilot, including Sonoma County. We were awarded $680,000 for a 3-year fiscal period. And our program was launched in July of 2019. The pilot provided dedicated funding for APS programs to help elder and dependent adult victims of abuse with stabilizing their housing. The program's been very successful statewide. So Home Safe must prioritize those individuals who are most likely to fall into homelessness, if not for the Home Safe intervention. So in order to qualify for Home Safe, one first needs to meet eligibility for APS services. And this means you need to be an older dependent adult experiencing abuse or self-neglect and have a housing crisis. At this time, our program in Sonoma County is comprised of 2 social workers, 2 APS social workers, and a social work assistant. And each of them works half of their time to Home Safe clients and the other half to regular APS cases. So as APS, when working with clients, we prioritize investigating the abuse allegations. However, when we're working with an APS client who's also under Home Safe, we also have another focus, and that's housing. Home Safe is close partners with Legal Aid, and Legal Aid will speak shortly. But I want to share that the services that Legal Aid provides our Home Safe clients, such as advocacy around evictions, is really essential to helping our clients stay housed. Home Safe provides intensive time-limited case management. And this can include stabilizing housing, current housing, by, for example, paying late rent, negotiating with landlords, helping to clean and organize clients' homes so they can pass HUD inspections. If housing can't be saved, then we help with an affordable housing search. And if necessary, help to link our client to homeless services. Our goal, however, is to prevent clients from becoming homeless in the first place, because we know that seniors and adults with disabilities are often extremely ill-equipped to living in shelters. We've served about 97 clients so far in our program. 76% of our clients are between the ages of 65 and 85. 13% are between ages 86 and 100. And the remainder, about 11%, are under 65. The clients we serve in adult protective services are often victims of abuse, such as financial abuse, psychological abuse, neglect, even physical abuse. Many of our clients are also self-neglecting, and that means, for example, that they're failing to pay their bills or attend to their physical or healthcare needs. So lacking stable housing would be a struggle for anyone, but it is particularly difficult for older adults. Homeless shelters are generally not able to serve like the functional, medical, and psychosocial needs of seniors. Older adults have difficulty with, many times have difficulty with things like mobility, cognition, or physical frailty. They may also experience incontinence or need a caregiver to help them meet their activities of daily living, like dressing or transferring from a bed to a chair. As a result, these individuals are often not able to stay at a typical homeless shelter and may be asked to leave. As you can see from this slide, all the clients we serve in Home Safe have disabilities which pose challenges not just for themselves, but for the service providers that are trying to help them. Difficulty with ambulation is by far the greatest disabling condition we see, but all of these factors listed are serious challenges, and they're often co-occurring conditions as well. So the success of the Home Safe pilot has led the state to expand and extend Home Safe, which is very welcome news. With the expansion of Home Safe, Sonoma County APS was allotted $1.34 million this fiscal year to use through 2024. And we anticipate another $1.34 million to be allocated next year. Our goal is to add positions to our Home Safe program so we can serve more people. APS social workers are not experts in homeless services, but we want to develop a close working relationship with agencies who are. We want to collaborate so that we can combine the knowledge of elder issues that we have with the expertise of homeless services providers, so we can offer the best support available to these vulnerable adults. This is one of the reasons I'm very appreciative to be able to have this presentation to this group right now. So I just thank you. So that concludes my part, and now I can give the floor to Ronit. Please stop sharing my screen. There we go.
Thank you.
Hey there. Thanks for that great presentation. So my name is Ronit Rubinoff. I'm the Executive Director for Legal Aid of Sonoma County. I've seen mostly familiar faces on this screen. It's really great to actually see people since it's been so long. Not getting any networking opportunities. I think most folks on this call probably know that Legal Aid has a range of crisis legal services. We serve elders with a range of issues, with a huge housing program, violence prevention program, disaster relief, and some other programs as well. So it's a broad spectrum program. And one of the things we really appreciate about the county, and I just have to say thank you to everybody who's on this call, who's part of the county, is how incredibly supportive they are of legal services and how much they understand the role that legal services play in stabilizing people's housing and safety and economic stability. It's really done a lot of great things for our community. So we don't take your support for granted and really appreciate it. So just a little bit of I think our role in this presentation is to kind of bring it down to earth in terms of like, what does it look like here in Sonoma County, and what are some of the stories and faces behind these statistics. Just on a broad level though, a third of our stats really reinforce what Sharon was talking about in the beginning. A third of our clients now are over the age of 60 across all our programs. And our elder team answered nearly 2,000 calls from seniors last year alone. And over 50% of all those seniors we help have some sort of issue related to their housing. Is absolutely, without a doubt, the #1 legal issue they present with. So what does that look like when I say a senior is coming with a housing issue? It has a number of different aspects to it. Straight up, of course, rental housing issues. Biggest issue that we see, I think, in the senior population are reasonable accommodation issues. So Esther's going to give you a couple of examples, but just a quickie. We had a senior who was on a second floor of an apartment in a wheelchair, and she was being evicted because people were complaining about the noise that her wheelchair was creating as she rumbled around her apartment in it. Not thinking, oh, we actually have an obligation to relocate this elder to the first floor and resolve this problem, which is what we insisted they do. She was getting evicted. So ADA accommodation issues are definitely a big thing that we see. Habitability, I think we had 85 cases involving habitability issues last year. We all probably know and recognize that when there's a crunch in the housing market, this puts a tremendous amount of pressure on the units that are available, and people don't want to complain. I had a client a number of years ago who was on what was then Section 8. She was elderly. She told me about sewage coming up in her bathtub, and yet was so afraid of losing her certificate and her housing that she didn't want to complain about it. So I have another client, I remember, who was 72, who was walking outside to take a shower at the unit she was renting. We also help elders with housing voucher issues. And we had about 58 of those last year. So that's another place where our intervention is really key in keeping people who finally get vouchers the ability to hold on to those vouchers. Of course, during this pandemic, we have seen a lot of elders affected by the pandemic as it relates to their stability in their rental housing. And that's come up over and over and over again for us. You know, their ability to comply with the regulations that they need to meet in order to get the COVID protections that were in place. We had a lot of interventions around that. But often an eviction presents with an underlying issue that's behind the eviction. So sometimes a senior will come to us with a non-payment of rent issue, but what's behind it is something else. For example, we had a client who had a public benefits issue. SSI was alleging that she owed them money and had docked her payment. And it was wrong, but in the meantime, she had no cash flow to pay her rent and was getting evicted. So we were able to intervene and fix the public benefits issue and get her back and stayed with her rent, and she's stably housed as a result. The other big issue I think that was brought up earlier is elder abuse. And so this is really an interesting crossover. The fact that we have so little affordable housing means that more and more caregivers and family members are co-located living with seniors. That then presents an environment which is ripe for more abuse. So the very issue that we're trying to avoid here is what causes more abuse. Then you've got a senior who doesn't feel safe coming home to their home anymore. Now their housing's at stake. So it's this really vicious cycle. So a lot of the cases where we have elder abuse are really about stabilizing a senior's housing by removing the offender from the home and keeping them safe. Finally, we also do some work with seniors in the, in the homeless prevention arena. So we have a homeless prevention program, and like you heard from Sharon, our elder population is not at all exempt from this risk. So we help them clear records like evictions and criminal records. Again, help them obtain vet benefits, maybe through VETS or BASH voucher programs or SSDI, and help them reduce medical debt to afford rent. So that's a whole, sort of set of issues that we help the homeless population with, and a lot of those homeless folks are seniors. Just to illustrate what we're talking about a little bit, let me just ask you, are there any questions about anything I said? Self-explanatory. Esther's going to tell just a couple of quick client examples to illustrate some of what we're dealing with. Oh, Esther.
Thank you. Hello, everyone. I recognize several of you, and there are some unfamiliar faces. Nice to be here. I'm Esther Limas, and I'm the supervising attorney for the Elder Law Unit at Legal Aid, among other units. So I'm going to share two examples of types of cases that we handle involving elders and housing. The first case involves Ron, who's 79 years old. He's a military veteran who suffers from severe depression, chronic migraines, and cognitive decline as a result of a head injury. He resides in low-income housing and received warning notices due to his unit being messy. Ron is a hoarder and was hoarding. Adult Protective Services got help for Ron in cleaning the unit. However, the property manager still issued an eviction notice. APS referred Ron to legal aid. Legal aid advocated for Ron based on his disabilities. Because of our help, Ron passed his unit inspection and was able to stay in his apartment. Ron is happy and relieved and is now more secure in his housing. The second client example is Sam. Sam suffers from AIDS and a heart injury. Sam was desperately trying to obtain housing, but his rental application was denied based on his credit score being a mere 32 points below what was required by management, which was 593 out of 625. His score was the only thing keeping his application from being approved. Legal aid made a reasonable accommodation argument by pointing out that Sam's multiple disabilities did not allow him to bring in market income, thus resulted in a lower credit score. Because Sam was on a tight budget, it was difficult for him to meet payment obligations. Sam's accommodation was granted and his application was accepted, and Sam has housing today as a result. Thank you.
So just in conclusion, you can see where, I mean, a lot of the threads that Sharon described, healthcare systems, public benefits and income streams, justice system issues, those are all sort of the crossovers that we see when we deal with elders and trying to keep them stably housed. And we just really appreciate our partnership with APS around this. Thanks.
Thank you all so much for that wonderful presentation. Do we have any board member questions and comments on any particular aspect of that presentation? Yes, Supervisor Corsi.
Thanks, Ben. I'm familiar with legal aid and I'm familiar with adult protective services, but I'm sorry I didn't catch what the acronym means, CSH. Sharon, can you explain how you fit into this system here?
Sure, absolutely. So the acronym is Corporation for Supportive Housing. We're a national nonprofit, so I'm not sure why corporation ever came to being, but we don't provide housing or services or work for a specific entity. We do a lot of capacity building and technical assistance work. We have worked with a lot of counties, cities, the state of California, and we are nationally, we're a HUD grantee or a HUD technical assistance provider. And mostly what I do is policy advocacy, which is another part of what we work on. So I have counterparts at the federal level who do federal advocacy. I work in California only, and so just do advocacy around having the state of California have more effective policies towards solving homelessness, and have been involved in the process to create, for example, the No Place Like Home program, and before that, the Mental Health Services Act housing program, and the Housing for a Healthy California program. So I've been involved in a number of, efforts to create programs in California, but I'm also a lobbyist. So I do a lot of work to try and pass legislation and mostly more money for housing and services. Also was involved in HAP, if you guys are familiar with the HAP program. I'm sorry.
Are you located in Sonoma County or do you work with Sonoma County?
I actually live in Los Angeles, but I'm in Sacramento very frequently, usually at least once or twice a week. So I would do a lot of work in Sacramento.
Okay, thank you.
Our hope was to provide an overview of older adults and housing needs kind of at the greater systems level and kind of funnel it down to Sonoma County.
Yeah, I appreciate that, Nadia, and the presentation was helpful as well. Sharon, I did want to ask you one question about your presentation. On your slide 5, where you were talking about a lot of the support systems that are out there, you didn't mention CalAIM, and I wonder how that fits into that continuum.
Yeah, and I'd love to come back and give you a whole presentation of my thoughts on CalAIM because it's a very big and important topic. I do think CalAIM, there's really a lot of good possibility there for connecting health systems more intentionally to the homeless COCs. And there's actually funding separately through the Home and Community-Based Services Spending Plan that's intended to provide managed care plans with incentives to more intentionally partner with our homeless response systems through their COCs. So I think that there's a lot of good opportunity there. I think right now the managed care plans, I think, are really struggling to figure out how to implement CalAIM in a meaningful way for people experiencing homelessness. And I think most managed care plans don't really understand the homeless response system or the needs of people experiencing homelessness, which are, very different than a lot of their other vulnerable populations. So I think CalAIM has some way to go. We've actually believed that we need to create a Medi-Cal benefit specifically for people experiencing homelessness that will make payment for services an entitlement. So everybody who's experiencing homelessness, or if they've been homeless and now they're living in housing, that they would be entitled to receive those services. And I think until we do that, measures like CalAIM have some promise of, working more close, having managed care plans work more closely with the homeless response system, but we'll never be able to scale up funding for services until we actually make it an entitlement. That's my opinion, and something that my organization has been working really hard to create. And we think the state of California will get there. They are talking about creating a benefit in 2024. So would love to talk more about that too, because it's a huge issue and an important one.
It is, and those kind of services are an entitlement now, but only if you're in enough crisis or actually homeless to get them. So
yeah, the CalAIM programs
are a little before that point.
Yeah, that's absolutely right. The CalAIM programs are designed to serve the top 1 to 2% of the most expensive Medi-Cal recipients. So they're not going to touch everybody.
Okay, thank you.
You're welcome.
Thank you, Jenny Lynn.
Yeah, so I wanted to thank everybody for their presentation. I think that there has been a growing need to discuss our aging and older adult homeless population, especially when you look at the increase we saw in our last point in time count, that we haven't really been able to have that strategic discussion yet. So I appreciate this opportunity to at least start it off. One thing that was highlighted that has been a long time concern of mine that I would just want to maybe voice to the board, not necessarily anything we could do at this moment, but just for people to be aware, it was mentioned about the incompatibility of shelter with much of this population. And this is something we've seen pretty frequently and pretty consistently over the years, in particular through our coordinated entry program. We've noticed for a long time, there's a group of people who shelters just cannot serve. They're not sick enough to be in the hospitals or to be in a skilled nursing facility, and they're also not well enough that they could actually be in a non-medical environment such as a shelter, because shelters are not medical. We are not medically trained staff, and it poses a risk for the individual and everyone living there. And it's a huge battle, and it's really been a heartbreak over the years to see this small but really important group of people who we have not or don't have a place for in our system. And so I just want to bring this up as a point to really grab onto that component. When we look at our system of care and the gaps in it, we have real data. We know the names of these people. We know their needs, and we know that right now there's a gap that we don't have in our system. And so as we kind of look through our strategic planning process, it's something that I hope we can address. Another area that I have seen that is somewhat along these lines, but not completely, is a gap that is a need, is around hospice care for individuals experiencing homelessness, providing people the dignity of a place to be in the final stages of their life. That it's, again, not completely this group, but it is this group in some regards, and there are these two huge gaps with this older adult population that we have seen and need to probably do some work on if we're really looking at a system viewpoint. So I appreciated those comments and wanted to highlight that we know these people, we know who needs to get a higher level care, and we need to build that out in our system. So, and thank you all for your work you do. We work with all of you constantly and couldn't do our work because you are the subject matter experts in that field. And we want to work with the people who know how to work with this population. But just wanted to highlight that as a huge gap in our system of care.
Thanks, Jalen, for highlighting those gaps. Don.
Yeah, thank you. And thanks to the team for coming. I know we've been trying to get this on our agenda for a long time, and it's nice to have the time to do that. I have a couple of questions, 3 questions, if I might. I think this is probably for Nadia, but you tell me. First, you mentioned in your presentation there are times when I think it was your APS social workers, look for housing for folks. And what I'm wondering, I mean, my guess is social workers are probably not great at property management and housing search. And I'm wondering if this is an opportunity for collaboration. We're talking, I think one of our next upcoming items today is to see if the board's interested in supporting some kind of centralized housing search, housing location system. And if we want to go down that path, is that a conversation we should invite you to participate in, or one of your team?
You are correct that searching for housing is something that we've had to learn, and it is very time consuming. And of course, we would welcome any opportunity to be able to access maybe a potential new resource around housing navigation or support. And I would welcome being part of that conversation. Anything that we can be a part of to help promote greater support and access to services to our seniors and vulnerable adults. Yes, we would really be excited to be a part of that conversation.
Okay, good. And now here's what you can do for us, maybe, or some of us anyway. I'm wondering. So 4 cities in the county, which have roughly 80% of the population experiencing homelessness, have these teams now. It's called In Response in Santa Rosa and SAFE in Petaluma, Cotati, and Roanoke Park. And I'm wondering if the people who run those programs know about you, and in case they come across cases where you might be able to play a role, have any kind of connections been established, or are we on completely different
Yes.
planet?
Oh, no, we're definitely on the same plane. We've actually had the manager from SAFE and the In Response team come to our APS meetings, and we've been in dialogue with both of them and are in collaboration and talking to each other, so that they are thinking of adult protective services when they encounter individuals who may be eligible for our services. And we are certainly thinking of those agencies or programs when we're reaching out to individuals too. So we're definitely in connection and talking to each other.
Wonderful. It's great to know about bridges instead of gaps.
Yes.
So thank you.
Yes.
Well,
Hey,
last
Dawn,
question.
Dawn, if I can interrupt for a minute, you didn't ask us, but I just want to add to this integration comment that we have a homeless prevention attorney who actually goes out with street teams and is integrated into those teams to make sure, similar to Nadia, that people know and are able to spot some of the legal issues that are, potentially obstacles to people getting housed, like some of the ones we just illustrated. So points well taken for sure.
Good to know. Thank you. Our last.
Actually, I'm sorry, if I may also jump in very quickly. We also have an elder law outreach attorney. And so we do have opportunities to partner with all of you, each of you, and your organization to present information regarding our services and how we can assist the community. So you can get in contact with us through our website, Legal Aid Sonoma County. Thank you.
Okay, good to know. Thank you. The other question I have is one of the slides, and Sharon, this might have been during your presentation, talked about targeted rental assistance for folks who are truly at risk. And my understanding is that the only high predictor of somebody becoming homeless is that they've been homeless at some other time. And so I'm wondering, how do you define high risk of, our count says 22,000 people on average are at high risk or vulnerable. How do you know who to target amongst 22,000?
Yeah, that's an excellent question. So there is some data that just came out, I think it was about a year ago from the California Policy Lab, which is run out of UCLA and UC Berkeley, and basically identified, I think it was probably about 10 or 12 different categories of people who they tracked as of people who have experienced homelessness and had these things in common. When they fell into homelessness, they had these things in common. It's not, it's not perfect data, but I think it is better data than anything we've had in the past. One thing that we have been concerned about is lots of times programs that are intended to prevent homelessness, they have like 99, 100% success rate. And we know that with that success rate, they're probably not capturing people who would otherwise become homeless without their services. So the California Policy Lab offers a window into what people have experienced before they became homeless. And definitely past experiences of homelessness are probably the leading predictor of who's going to become homeless again. But there are other factors too, like if somebody has used a combination of county services, where they didn't use a lot of county services before, and then all of a sudden they're using a lot of county services, that can be a predictor. And then there are a whole bunch of other ones that I wish I could remember off the top of my head, but usually it's a combination of those things. Somebody who's also living with 20% or below of area median income, that group is much more at risk than above 20% of area median income. And if they are living doubled up or in overcrowded housing, that's another factor. But if it's helpful, I can send the list of factors that we've kind of put together based on the California Policy Lab data.
Eviction is usually one of those factors in studies I've seen, though I'm sure they vary, but a certain number of evictions on a record usually indicates that risk factor as well.
Yeah, that one wasn't on there, but there are, like, if it's an eviction and other factors too, like if they don't have a lease, because they're living with somebody else or something like, so there are, yes, you're right. I think there are a number of factors that you can look at somebody who's being evicted and see if they meet those as at risk.
That'd be great, Sharon, if you could send that to
Sure.
staff to disseminate to the board. I think we'd love to see that and read the California Policy Lab research that I'm sure is probably posted online somewhere. Elena?
Yeah.
Well, first, I want to thank the panelists. I think that it was just a really insightful presentation and some of my favorite organizations presenting, so that's fun too. And then for Sharon and any of you really, but I'm curious about long-term care options for unsheltered, because I've seen that as a gap when Jenny Lynn was mentioning hospice, I've worked for Kaiser Permanente, so looking at hospitals and just what we're seeing, we're really seeing a challenge with frail elderly who don't have the long-term care support. So it might be that they don't need to be hospitalized, and then they're beyond recuperative care, which we do have an option for here in Sonoma County. But that long-term care is a huge gap. So I was just curious, if there's work in that space that's being taken up at a policy issue, at policy level.
Yeah, thank you. One of the issues that we're working on is really looking at how Medi-Cal can fund long-term services and supports, but in housing that may be more independent than where those programs are otherwise offered. So like assisted living waiver usually is offered in assisted living, which, can be in a licensed facility, more of a long-term care model sometimes. And I think we would like to see maybe expansion of that concept to offer those services in housing, so that people are getting that really intensive level of support, but maybe they're able, if they are able to live independently, that there's that option. Right now, we don't really have options like that in our continuum of housing options. And so we're really trying to figure out, can we pair long-term services and supports in housing and make that kind of a new piece of the continuum. So I absolutely agree. There are people who need long-term care that I think could live more independently than what they have to live now, because they have to go to a licensed setting because there's no other option for them. So I don't know if that makes sense, but just to you, but just trying to find like the gap in our continuum and trying to fill it a little bit with some, to try and satisfy the needs of some people who really don't need to live in a licensed facility. I think too, the comment about hospice is very, very accurate. And we do see that hospice services or palliative care offered in supportive housing can be extremely successful, but it's not a model that's funded that way. Like, you really have to work to piece together the services and the housing. And otherwise, you're not going to be able to get the services if you're living independently in housing. You're going to have to go into a facility to get those services. So that's kind of where we're kind of focused on, really trying to figure out, is there another a type of housing that we can create in the continuum that wouldn't require people going into licensed facility if they don't have to go.
Thank you.
You're welcome.
Thank you so much. Those really great questions and really wonderful informed answers. So thank you all for that. I'm not seeing any other board hands, so I think we can move on to public comment on this item. So if anyone from the public would like to make a comment on this particular agenda item, which was our Human Services Department presentation and their partners for older adult housing needs, please raise your hand and staff will unmute you and alert you when it's your turn to speak.
I'm not seeing any hands.
All right, in that case, I think it's time to move on to our 5-minute break. I've got us at 2:50, so I think we can adjourn until 2:55, and we'll see everyone back here. Please just turn your cameras back on when you come back. Thank you. All right, I have us at 2:56. So if board members could please turn their cameras back on when they're back, just so we can make sure that we have quorum. All right, it appears that we do indeed have quorum, so we'll move on with our agenda. Our next agenda item number 6 is Word from the Street, and Rebecca Samet, who's the proxy for Ludmilla Bade today, is going to talk a little bit about her experience with the Palms.
Yeah, this presentation today will be interpretive dance, if you guys don't mind. Just kidding. Let's see. So I'm gonna skip around a little bit. Word on the street is Burbank Housing will be or has started to contract with Akasha at Palms Inn, and just trying to figure out if there's any truth to that and what their involvement will be there. Does anybody know?
I mean, I can chime in. So yes, Burbank Housing is currently doing the property management for the Palms Inn, not the supportive services. Yeah, the charity is still doing that, but the property management Burbank Housing is doing.
Okay, thank you. Now the other thing I wanted to talk about was the Turning Point building. I believe that is up for sale, and I'm wondering if any providers are putting in bids to turn that into a possible long-term psychiatric care housing facility.
I can chime in here and say that, not that I know of on that one, but we did just last week open a new psychiatric health facility in Sonoma County.
At Los Coast location?
Yes, at the old Valley of the Moon Children's Home. And
Yeah.
the Turning Point is a much larger building. You're talking about the one off of Corby Avenue, is that right?
Arrow one.
Yeah. Much larger building. And the reason that the psychiatric health facility at Los Quilicos is the size that it is because of federal reimbursement rules. If you have something 16 beds or less, you're eligible to get your money back, basically. And if it's larger, you don't. So that's what I know that the county is doing as far as psychiatric hospital issues. I don't know if anyone else has an eye on Turning Point.
Okay. Thank you for that. Even if it were possible to use Turning Point property maybe to transition people from psychiatric care who have come out of crisis and then have stable housing with much more support than than we have now, I think would be great. So just to put that out there, put it on the table, let people be aware of it and know that people on the streets know about it, and they're hoping that somebody steps up to take that on.
Rebecca, these are great questions. I just want to point out, we also have another agenda item called board member question and comment, and you can always ask questions then as well if you wanted to do your word on the street about the Palms. But it's up to you. We're happy to entertain your questions when it's most comfortable for you. But we do have a section on the agenda just for such questions.
Okay. Well, the only other thing I was going to ask about and talk about was the warming station effort that happened over New Year's, and just hoping that, and curious as to if there's going to be a countywide effort, if that's starting to, if we're going to be able to deploy something countywide, or if the cities are going to be having to deal with that individually. And yeah, so that's pretty much it. I did visit Palms. I did talk to a few people there, and it was a little uncomfortable. So that's why I was just curious about Burbank Housing and that situation. And that's and the project Home Keys sounds great. I've seen so much effort. I've been kind of in the background here. I see a lot of familiar faces from when I was on Home Sonoma County before the COC was reconstructed, and I am serving on the LEAP. I just got accepted to the board the other day. So I'm still here, but I probably won't be trying to get back on the COC. I started my own organization, so I'm really busy with the summer camp. But I'm really happy to see everybody still here and still providing services and working on making it better. And so good to see you guys, and thank you.
Thanks, Rebecca, and thanks for joining the Lived Experience Advisory Body. That's awesome. Glad to hear that's about to launch. So that's wonderful news. Are there any, and we can certainly answer questions about warming stations and stuff during board member question and comment if staff want to comment on that. But do we have any board questions or comments for Rebecca for her word on the street? All right, not seeing any, let's go to public comment. If anyone from the public would like to comment on this agenda item, which was word on the street, please raise your hand and staff will unmute you and alert you when it's your turn to speak.
Not seeing any hands.
All right, we'll move on to our next agenda item, which is standing committee reports. And I believe our first standing committee report is going to be Coordinated Entry Advisory Committee. And I believe it's going to be Ty Hilton talking about emergency housing voucher update.
Thank you. Aaliyah, I think for this one, we do have slides, correct? Okay. I knew there was slides somewhere.
Andrew, are you able to share screen?
Yeah, I was asked Ty. I wasn't sure if you wanted to put up a PowerPoint or if you wanted me to share the slides, but I can definitely share them for you.
Yeah, if you could share them, that'd be great. Thank you.
Will do.
Okay, thank you. Yeah, so the emergency housing voucher, the EHV, I've provided a couple updates on that, but just a little background. Sonoma County, the Sonoma County Housing Authority and the City of Santa Rosa were awarded approximately 284 emergency housing vouchers that were dedicated to individuals experiencing homelessness or at risk of homelessness. Over 20 different agencies participated in the EHV program. Service providers were made referrals and assisted clients in gathering documentation to get their vouchers. That work is still ongoing. However, all of the voucher referrals have been made, and the referral groups have now shifted their focus to housing navigation. On also, some of the EHV partners are participating in a centralized housing location program to generate housing leads for those EHV voucher holders. Next slide. So I'm sorry if these tables didn't come out as well in the PowerPoint. They were in the packet as well, but this just goes over some the number of some basic data about the referrals. So there were 24 agencies in total that referred at least one or more individuals to the EHV program. And then you can see they're split out into categories of rapid rehousing and chronically homeless. The other categories are also present. The HHU is the high hospital users. PSH was those move-ons. The DV is for the domestic violence. And then there's, of course, the TAY referral. And then there's a breakout of how many were issued to each or referred to each housing authority. Next slide. This one's even more difficult to see. Unfortunately, I couldn't make it any better on a PowerPoint, but basically this breaks down by agency how many vouchers they referred and to which subpopulations. Something to note is you'll see the total in the bottom right is 271. And I did mention there's roughly 284 before. Those numbers don't align for a couple of reasons. The move-on vouchers, unfortunately, we didn't, the Housing Authority reached out to PSH providers directly and received those referrals directly. They didn't go through the group. We did attempt to get numbers from agencies on how many they referred. Unfortunately, we weren't able to do that except for Catholic Charities. But there will always, the vouchers will, there will be a discrepancy in numbers that could be because some of the referrals, while the client hasn't been officially referred to the housing authority yet, because the agency is working on gathering documentation, or vouchers that are ported out or ported in to the jurisdiction can change the total amount. So these numbers will continue to change. And unfortunately, not all of that was there. And at this point, if you wanted to, I will take questions about the EHV program.
Yes, Tom.
Thank you. Thanks for that report, Ty. You know, I've had some conversations with Santa Rosa Housing Authority, seen some of these similar numbers. The data point that's missing for me is how many people actually have vouchers and housing versus they have a voucher in hand, but they're still looking for housing, which does lead into our centralized housing location. But do we have those numbers yet, Ty?
I got an email earlier today from the Sonoma County Housing Authority. They send out weekly emails with updates of how many folks have been leased up. I'll pull that up here real quick. I don't get those as much from the city of Santa Rosa, but they will be providing their quarterly report to this board on February 1st is when that's due. And I've sent that to them, and that will have all of those voucher numbers leased up, issued and searching, and also will have a demographic information.
Ty, I've got it here. It's 19 leased and 5 are RTA. That means they're almost leased up, right?
Yeah, RTA means that they have a landlord and they're waiting on an inspection.
So 19 and then 5 pending.
That's just for the Sonoma County Housing Authority. It doesn't include City of Santa Rosa.
And their numbers 19 out of 100 and what, 180 something maybe? Or 150 something?
Yeah, 150 something.
50 something.
Okay. And I know also with the EHV, there's some timelines. How are we doing with any potential timelines, either to get more vouchers? And obviously, it's tough to make that argument if we've only housed 19, at least from the county side. Are we doing okay with any of those timelines and or in a position to potentially get additional or continued funding streams for this program?
You know, that's a great question. I put that question to Martha recently. So there's not a timeline where, you know, this date passes and we would lose the vouchers. But the amount that the housing authority, or I'm sorry, the amount of vouchers that HUD will dedicate to a community is generally based on the number of vouchers they have leased. So at the end of this year, they will look at the number of vouchers that we have leased, specifically, well, all of the vouchers, but specifically the EHV vouchers, and that will inform their decision on how many they would, give back to the community. So the more that we can get leased up, the more that we potentially could get in the future. So there's not a hard and fast deadline, but there is an urgency to get those folks leased up and as many of them as possible.
Great, thank you.
Yes, Nora?
Thanks. I just wondered, do we track or have available other demographics on the recipients? Do we track race, ethnicity, or other characteristics of the recipients?
Yes, we do. That's contained in the report that I mentioned that they will be submitting to me on February 1st, and then I can send it to this board as soon as I have it.
Yes, Supervisor Corsi?
Thanks. Appreciate getting this information. I know we live in a really tight housing market, and we talked about this, you know, when these vouchers were first made available. But I'm wondering, is 19 leases out of this many vouchers, are we considering this a good pace? Is it alarmingly slow? Is it pretty much par for the course? Give us an idea of how this is working.
I think I was just going to chime in, Ty, maybe you've seen this too. There's actually a supervisor, there's you can go on, HUD has a dashboard where you can compare every housing authority in the state. And just looking at it right now, there's actually quite a few who haven't leased at all. Some who are high. I think we're pretty much median, it looks like. And I'm seeing Santa Rosa with 13, but I don't know if that's been updated. I can try to get this and we can send it out to the board so everybody can, it's an interactive tool where you can sort by state and housing authority and see what the utilization rate is. Looks like
Okay.
we're kind of in the middle.
Yeah, I'd like to talk this up and, make sure the community understands that, we not only have this opportunity, but we need housing to make it happen. So any help you can provide would be great.
Yeah, and if I could just respond to that, that's and we're going to talk a little bit more about that in a minute. But that's really the goal of the centralized housing location, part of EHV. What they're working on now is developing a marketing and outreach plan to landlords, and we're hoping to get funding that we can do a little fund that. But basically, that's one of the main goals, is to develop a shared narrative that we can all have and get that out to landlords. And that work's being led by folks that have a real estate background and are do that housing location work. So certainly is something that we are working on.
Okay, thanks, Ty. That's good news.
Lisa?
I'm glad that I get to talk when it's actually my turn to talk. So I apologize again. I hid under a rock enough to go ahead and just talk freely. But anyways, I wanted to just mention that, as Ty said, that there was 19 that have been leased up. I do think that maybe that number is actually higher. If I had to guess, of how many of the utilizers of the vouchers are actually in housing, because both housing authorities had so much work to do in such a short amount of time. I know that on our end, and I'm just going to speak for SAY, of everybody that received a voucher, the majority of ours are in housing, but they haven't had an inspection yet to actually qualify to be leased up. So we've talked to like landlords that they have a voucher and they'll be utilizing the voucher, but we're paying for the rent while we're waiting for them to get their inspections completed. So I actually, as I was asking staff in the other room, I mean, we have 10 young people that are in leases right now that have a voucher, but not all of them have had their inspection and the completion of it. So I actually think that a lot of, that we might be a little bit higher than what the numbers are right now. And I know that the county and the city are both pulling as many resources as they can to support with all of this work attached to these vouchers in such a short amount of time. So.
Yeah, and I'm just brought up the HUD dashboard while we were having this, and it looks like in the state of California through 125, there's less than 1,500 people that are housed and 5,500 that are looking for housing. And even the county of
8%.
Los Angeles Housing Authority says it only has 90 people housed. So
It's
seems
8%, 8% lease statewide, Ben. I was looking at, that's out of 17,000, only 80% are leased.
Yeah, it seems like we are par for the course, though anything we can do to improve and quicken the pace is certainly still something we want to do. Margaret?
Yeah, and I know I bring this up quite a bit, but some things that really concern me, and I think that we need to start talking about, and I think centralized housing location is a good place to start to coordinate efforts. But nobody really knows what is the inventory of market rate housing in Sonoma County. No one can answer that question. And so as much as we think that coordinating and getting this centralized housing location in place is going to lease up these vouchers, yes, it'll help. But at some point, my guess is, my uninformed, uneducated guess, because no one can give us any information, is that we're going to not be able to lease up all of these vouchers, or that's gonna drain it. I mean, we don't have market rate housing in Sonoma County enough that we can keep sustaining the vouchers. So I think, the next conversation we really need to start focusing on is, where are we going to get more permanent supportive housing? Because it doesn't exist, and these vouchers are not all going to get leased up, especially if we keep taking more on. At least it seems that that's the case. No one has an answer as to how many we have. So that's just what keeps me up at night, is at some point we're going to hit a wall, and having a centralized housing location isn't going to help us, because it's not about finding landlords, it's about actually having units.
So I'm sorry, Margaret, can you clarify, are you saying that you believe that there's too many housing units, that the monthly rent is above what the voucher will pay? Or are you saying that there's just
Yes.
not enough vacant units?
Both, probably both, honestly. And I've asked, several times, what is our inventory? And I don't know that we have a good inventory system in Sonoma County to really say what our inventory is. So I know in northern Sonoma County, we don't have market rate voucher qualify. Like, we don't have units that would qualify for vouchers. Maybe one comes up every once in a while. And so I'm assuming the rest of the county is going to have that same issue at some point with the amount of vouchers that we're talking about.
Yeah, it can certainly vary region by region if they're doing market rate for a large, geographic area, for sure. Jenny Lynn?
Yeah, I just want to say it's great to hear that we're kind of on track and maybe even exceeding in some other communities. I want to just, take a minute and thank everybody. The behind the scenes work, I'm not sure if everyone at this board is aware of how much time and energy and effort so many people, Ty included, are putting into this effort. And it's nothing short of amazing, because this is a different way of doing business for us, I think, as a community, in terms of really like case conferencing and working together to collaboratively find housing and kind of getting out of what has always been some silos, I think, in the past. And it's really exciting to hear the centralized housing location stuff that's coming forward and other opportunities coming out of it. But this is a new muscle, I would say, for our system of care that we're building. And I just want to make sure that, there's great things to learn. There's still a lot of progress. There's a lot that still needs to be done to meet our voucher kind of total goals. But the work that we're doing and the progress we're making in that new way of doing business is very exciting. And I just want to thank all of the people who are sitting in those case conference meetings on a multiple time a week basis sometimes, and working through that kind of discomfort to get to a better way of doing business. I'm just really grateful. And Ty and Michael and so many of you at the CDC have just been instrumental in bringing that forward too. So I just want to thank you as well.
Thanks, Jenny Lynn, for all those acknowledgements. I think that's really important. And what you're just saying about having to kind of create a new system in our county to do this is totally true. And, having to do that maybe, delays people getting housed a little bit, but it's a system that can be used in the future. And I think it's just really, really important. I know our neighboring county, Marin County, had some of those systems in place already. And, according to this dashboard, they only had 117 vouchers issued, but they already have 71 people housed. And their housing market is just above market and just as low vacancy rate as ours. So it is possible. And I think having these systems in place in the future might be really, really helpful. So thank you to Jalen, Ty, and everyone else who has been the ones launching these systems. Ty.
Yeah, thanks. I just wanted to share a couple things. So part of the limitation was mentioned earlier. We would like to have more folks with issued vouchers, but the speed with which the partners have been able to get these referral packets done and into the housing authorities, they have limited staffing and and their normal caseload. So I'm as things move forward, I'm confident those numbers will pick up. And then to respond, to what Margaret was saying, is certainly a challenging market to do this in. I think that you're absolutely correct on the smaller one bedrooms and studios. The market is generally asking for more than what's offered. But I think with the larger voucher sizes, which we do have some because some were directed towards families, those units do come closer to what the market's asking. And I think that, as Ben pointed out, Marin is able to find a lot of housing. So I'm not saying it's going to be difficult or it won't take time, but I am confident that we can, with some outreach and some incentives, that we can get a lot of these vouchers leased up.
All right, let's move on to our next committee update, and then we'll take some public comment and then move on to some further committee updates. The next one on our list is Strategic Planning Committee, and there's a couple of different updates here, including one on the centralized housing locator that was alluded to here. So it seems like a good segue. And Tom Schwedhelm, as the co-chair of that committee, will be helping give the update.
Thanks, Ben. So I'll be going over some notes, and thanks, Aaliyah, again for keeping track of all of the directions that we're going. I'll be talking about several items, and then at the conclusion of my remarks, I'm going to be asking for some direction of the COC on this whole centralized housing location function. And I'll be turning it over to Jenny Lynn Holmes to talk about the open HMIS system, and because I think she and her group would like some direction from this body. So first of all, we're currently working with Home Base on phase 1 of strategic planning, which centers around the development of a homeless action plan to be used by the Sonoma County Board, us, and Sonoma County for HAP round 3 funding. In collaboration with Home Base, we're developing a structure for the strategic planning process, reviewing and analyzing existing data, and soliciting feedback on emerging issues. You know, all of us are busy, and there's so many different meetings that I think all of us are attending. And sometimes it's like, okay, which one is this one related to? But it's all, you know, we have so many different areas that we're working on improving. So it's very impressive. So let me go to a couple of these others, and then I'll come back to the centralized housing. For our housing work group, they've been assessing available housing interventions and support services and working with Home Base to address specific housing questions. And Margaret, you might want to touch base with Tom Bieri, because he's done a lot of that research. And Stephen, if Tom's not the person that, well, you should direct Margaret to, but he's done a lot of that research. And that work group did come up with about 7 questions for Home Base that I think this week they will be answering. So once we get some of that, we'll figure out roles and responsibility for the work group and what Home Base will be doing. And then on the increased income, and Karen Fees has been a rock star in this work group. And Stephen's there too. I don't want to not acknowledge you, Stephen. And there's probably some others too, but Karen is really doing a great job on this. And they're identifying what income is available and developing a comprehensive document that holds the information, and then how people experiencing homelessness and at risk of being homeless best access income, and how do changes in income impact eligibility to benefits, and then how does the community and partner agencies know about the income spectrum. So all that work is going on now. And then moving on to the housing location services, I'd like to receive direction from this board to continue down this path, because there could be some people that say, I don't think this is the best use of our time and energy. The work group or our subcommittee has recommended we want to go in this area. So we just want to affirm that direction, because then the next step, if this group says, yes, we like the concept, as Ben mentioned, that Marin County is employing, where you have a real estate professional, customer service, leading the efforts, which would complement, not compete against the other housing location services that are currently going on in Sonoma County. What was the other thing? Oh, and also we've got this work group that Ty has been heading, where we've talked a little bit about the different role and responsibility of location, housing locators versus navigators. Many agencies and organizations combine those, they wear different hats, but we're kind of focusing on, no, this is just going to be that real estate professional that finds the unit. And then I can see a system where then they would say, here are the units, what's the best fit through our homeless system of care. So the additional, if this body wants us to move forward, that other work group will then continue talking about, okay, where's the money come to pay for this person? Where would this function be located? Don mentioned one potential suggestion with coordinated entry. That's a possibility, but we want to flesh that out. And then equally as important, the roles and responsibility of this role within our homeless system of care. So with that, I'll just open up. Are there any questions about the housing location services? Because I would like to put a motion forward that this body support the direction of this work group. And Ty or anyone else who's on that committee that may has been participating, if I've missed something, please share any additional information.
Yes, Wida?
Hi, so I'm wondering how you will address equitable distribution as well as access, and how Marin County maybe has handled that with all of, excuse me, with all of the other service providers. How do we ensure that one person doesn't get 10 and another person doesn't get 0? So just wondering about that.
Yes, absolutely. That is yet to be decided, because again, the work groups, and Ty has some experience trying to facilitate the work group, because quickly we can get into the weeds here. So this is still, we're trying to keep it at the policy level. And then those that are currently doing that work are continue to answer that very question. So again, we want to complement the current efforts and not compete against the current efforts, but all that will be worked on with the subject matter experts. And eventually that would come to this body. Ty, do you have anything else you'd like to add to that question?
Yeah, so it's a great question. We don't know the answer yet, but I've seen several different methods, and I don't know, to be honest, what Marin County is doing in that respect. So it would be good to reach out to them to figure out. But so Catholic Charities actually has some robust housing location that they do, and they have a great system where folks who are interested in a housing indicate what type of unit they're looking for, so size of the unit, location, any amenities that they might want, and so forth. They fill out a questionnaire, and that information is entered into a database. And then when a unit is identified as available, they are able to pull the names of applicants who fit the description of that unit. So if it's somebody that said, you know, I'm interested in living in North County in a one bedroom somewhere, you know, near public transportation, and there's a unit that fits that bill, then anyone who fits that would be made, an offer would be made to those folks first for that. So that's one method. Another method I have heard of is creating kind of is software out there that's essentially like a Zillow but just for homeless services. So you enter the units in there, and then any service provider can access them as if they were just on Craigslist or Zillow looking for a unit. So those are two potential ways to do it, but we haven't figured out that. But there are models out there that we can look at.
And some of the other conversation, at least that I know I'm engaged with, is talking with some of the industry professionals who actually are property managers. Also some of the other, like California Apartment Association, Marin County, actually, the way it was described to me, it almost started as an adversarial relationship, but now they're on board because they all understand, again, that roles and responsibilities. Additionally, I personally have had some conversations with the city of Santa Rosa, are both state and federal lobbyists. You know, in talking last night, you know, the federal government gave $5 billion for these emergency housing vouchers. My own personal belief wouldn't have been nice if we would have a little bit additional support. So it's great that they have that, but I'm asking our lobbyists, hey, can you go out with your hands open? This is great, but we need some additional assistance because we need the units, not just the vouchers.
Thank you.
Yeah, I don't know all the details of how Marin does it, but their centralized housing location is through the Marin Housing Authority. And then it's also Housing Authority vouchers that are going through coordinated entry for people getting permanent supportive housing units, in addition to other type of Housing Authority vouchers. So it's a fairly seamless process because it's the Housing Authority doing the location and Housing Authority vouchers that they have allowed to go through coordinated entry for that purpose. So models here may differ, of course. Margaret.
Yeah, I fully support centralized housing. And I think that, you know, the voucher process that we went through really proved how we can pull together and work as a team and get things done. And so I'm really excited that we're moving into this direction. Some things that I would consider is looking at who the housing locators are already. I know Marin started with the Housing Authority, but they actually have service providers who have housing locators that work with the central housing location. So to Ben's point, our model might be a little different because we have way more housing locators in the county, but I think it would be a good, wise use of time to see who do we already have that's doing the housing location, and would one of those people who are already doing it make a good lead person for this effort versus hiring someone else or, you know, starting from scratch. I've heard that Catholic Charities has a great program and some great software like Ty mentioned that we might be able to leverage. I also think it would be good to just get a good inventory of how many housing locators we have in the county doing the work so that we know exactly how many we have and where the gaps are, geographically speaking. So just some thoughts, but I think in general, it's a great idea. And I think that we can really leverage kind of how we all came together for the housing vouchers to kind of keep moving this into a direction where we can get people housed more quickly.
Thanks for that, Morgan. That question, I know Ty has already asked, and we're waiting for some feedback about who is doing the housing locators to do the very things that you were just describing. So thank you.
Yeah, Don?
Thank you. So I have several thoughts on this. And first of all, one of the practices we try and adopt in Runner Park when we're facing challenges is to look outside of what we live and know. For other people who have addressed the same problem. And I'm really pleased and appreciate that whoever made the connection with Marin County. That's wonderful because they know how to do this. I have a question, I think probably for Nora, and that is, we know that we heard about the human services side of the county, and I know that the county behavioral health supports housing as well. Do they do housing location or recruitment of landlords, or how does that work? And I guess where I'm going is, should they be part of this conversation as well, so we're not continuing fragmented, siloed efforts, but maybe bring them into this conversation directly as well?
Yeah, thanks, Don. I don't think that that's a primary part of any of the work that our behavioral health staff do, though obviously helping to secure housing is often a big part of the case management that staff do. You know, I would remind folks that the IMDT, Joe is part of health as well. And I think, so it could be a great question to think about how we might engage behavioral health in the process, but also how we would engage the IMDT staff as well. Sorry, you moved for me on the screen. Yeah, so I'm happy to talk about that with leadership and bring something back here or have that conversation offline. I think it's a great idea to be looped in.
Yeah, I definitely would like us to be working together across institutions, organizations, and with as few silos as possible. So that's the intent. Appreciate you moving that forward. To Awita's question about how do we prioritize inequity, to me, we have a principle we haven't talked much about here, but of basically geographic equity, where resources are allocated based on the extent of the population experiencing homelessness across all parts of the county, so it's not concentrated in one area. And I think there's a lot of merit to that. I would also suggest we again, this is back to using data, but whoever delivers the results and has a system that works should get priority to some degree, because that's making the best use of the resources that we have. So that's for what that's worth. I'd also potentially, and Tom, this might be going further than we're ready to at this point, but want to put this out there, is essentially making COC funding for certain services conditional on participation in this centralized housing locator service model. If this is something we really believe is going to be effective, then maybe that's a condition we ought to put on our funding decisions, is support for the system as a whole. And I guess my takeaway from this, and Ty, kind of go back to what you were talking about, and Margaret, about the tightness of the housing market. I think that's very real. It is a reality that we face here. But if Marin County can get 60% of their vouchers leased up by now, I don't want that reality to become an excuse for us. Other people have figured out how to do this in similar situations. Then we can figure it out as well. And I'm really glad that the strategic planning group's on top of this, and that Ty's deeply involved in this, because I think those are the right people to make this happen. So we desperately need to improve our system. This is a grand opportunity to do so. So that's it. Thank you.
Thanks, Don. And so,
Don, I appreciate that comment just from the perspective of, if our numbers are middle of the road. I don't know anyone on the COC saying that's what our goal is. Let's be middle of the road. No, we want to be leaders in this area, and it's a very motivated group. And I think we're heading in that direction to show this is how we can change our system to more effectively house people in Sonoma County.
So one last comment from Lisa, and then I want to go to public comment. So Lisa, go ahead.
Yeah, I doubt we're even in that stage yet of planning, but one of the things that stuck out for me that when Marin was given their presentation was that this is centralized housing location for vouchers. And so I think that it brings up another issue as we have rapid programs and different things like that that are not attached to a voucher. We still have the same struggles, and I feel like there is a way that we can do this program and keep that in mind, because it is a lot easier for you to get housed with a voucher than versus a rapid program. So I don't want us to be counterintuitive why we're doing this type of work and thinking about centralized housing location, because it is still going to be a struggle for all of us as we're trying to get housing units for our rapid rehousing clients. So just keeping that in mind too. I mean, we don't have to be exactly like Marin as we're going forward with this. But I do want some of those factors to be a thought while we're doing this.
Absolutely. Great points, Lisa. And Tom, I believe what we're looking for today is just, just support from the board to continue the investigation, continue working along this, that this is a good place for our, our committee and work group to spend their time. Is that right?
Yes, and I was going to ask your preference. Do you want a motion, or if everyone's okay, go continue in the direction you're going, we'll go full speed ahead. We just wanted to check in with his body to make sure we're going in the right direction.
Yeah, no, I don't think we need it. We don't have an action item listed on the agenda. I think we could still have one if we needed one, but I think we can just just ask if anyone feels that we should not be doing this and should be spending our time elsewhere. And if so, please speak up now.
What he said.
All right, thank you, everybody. And I would like to go to public comment now. We had a couple of kind of meaty committee updates here, and I want to give people from the public time to weigh in before we move on to some other shorter committee updates. So if anyone from the public would like to comment specifically on the coordinated entry update, which was focused on the emergency housing voucher update, or the strategic plan committee update, which was focused on centralized housing location and home base. Although, Tom, I guess maybe I should ask you, do you want to do the open HMIS?
Well, it's up to you, because we should get public comment on both those items.
Sure.
We can do
let's do open HMIS with Jenny Lynn, and then we'll do public comment on the whole committee update instead of splitting it up like that. I'm sorry. Go ahead.
Then I'd like to introduce Jenny Lynn Holmes from Catholic Charities, who's going to talk about the open HMIS system and progress in that arena.
Thank you. So we've had, as part of the coordinated system of care, some big discussions around open HMIS, in particular, continuing to vet out what is possible, what is not possible, and how we can have better, more enhanced coordination of care around the populations we are trying to serve, reducing duplication in intakes, reducing the re-traumatization that happens during multiple intakes clients have to participate in, and also making sure that there's, we're picking up where one provider left off from, and possibly even enhancing our data gathering overall with maybe potentially minimizing duplication. The committee had some big discussions around particularly where the responsibility for this goes, and we'd like to make a recommendation to the board here and get feedback on that. But we do have an HMIS committee, and while we would coordinate with that committee, the feeling is that the work we need to do to get an open HMIS system functional requires individuals less on the data intake and analysis side and more on the social work and coordination of care side, which is kind of different individuals and different expertise. And so we would like to recommend to the board that the coordinated system of care, which flows through the strategic plan committee, kind of is empowered to move forward with this open HMIS responsibility. We would report up to the strategic plan committee, and that would also come back to here to this board. But we would like to make that recommendation and look for maybe thumbs up that the board agrees for us to move forward in our process similar to the centralized housing location. So I don't know if there was anything to add from either Stephen or Tom as the chairs are there, but I think that's the big request we have.
That sounds like a pretty good encapsulation, Jenny Lynn. I don't know, Tom, I see you unmuted if you had something to add.
I was just going to say, just to put this all in perspective. So this group, we started our subcommittee prior to Home Base coming on board. So this is what our group decided. This was kind of the low hanging fruit: centralized housing location, open HMIS, housing, and the income. I am guessing as we continue, or as Home Base continues the process of getting community feedback, as we develop our strat plan, we're confident that at least these two items will be included in there. But again, this work has been ongoing. We didn't want to wait for the strat planning process when we know this work needs to be done.
Excellent. Do any board members have questions or comments about that work group pursuing open HMIS, just investigating the possibilities? All right, I see Margaret.
Sorry, really quick, I'll just say, and I've said it before, gosh, a lot happening on this meeting today. But just super excited for the possibility that we might be able to improve this data and stop the re-traumatization of people, and the fact that it looks like we might be moving forward with this is just a really big step, I think, for the county. And just thank you for everyone working on it. I appreciate it. And I think a lot of people appreciate it. So thanks.
Thanks, Margaret. Don?
Yeah, I want to echo that. This is, again, to me, a good example of looking elsewhere. Margaret brought this up 6 months or so ago when we were talking about a by names list. And it feels to me like it's kind of been sitting there, and I'm glad to hear it's not. I'm glad to hear it's moving forward, and we've really got people taking ownership of that. So Margaret, the day I hear you say that some client had a better outcome because of the shared data will be a day that I will definitely be smiling about. The one thought I have is to, particularly given their commitment earlier today, is that as soon as Home First is here, to invite them to participate in these kinds of conversations, at least where it's on the front end kind of role of the coordinated entry provider, given their reputable background and perspective. I think that might be useful to have them involved in the conversations. And then just one question, if I might. I understand that one of the reasons we don't have open HMIS is because of privacy concerns that may have a legal component to them. And if that's true, I would just ask that we research those now instead of waiting to the end to find out there's a problem, that we work on that concurrently. And I know our access to attorneys is a little bit ambiguous, but I don't know even if that's an issue, but I've heard that Michael has said it is for years. And if it is, let's get it resolved. And if it's not, then let's know that and make sure that doesn't impede us as we go.
I'll confer with Daniel on that, but I think we have a solution to that. So that.
Yeah, and that's exactly, I think, why we need to be collaborating with the HMIS and data committee, is we have some technical experts who know a lot about HUD compliance and what is allowed and what other communities are doing with their HMISs and are able to do legally. So, so all that's been talked about and on the table, and Tom and Jenny and Lynn have been really at the forefront of that. All right, I'm not seeing any other board hands, so I think we can move to public comment. If anyone from the public would like to comment on the first two committee updates, that was Coordinated Entry Advisory Committee, which was the emergency housing voucher update, and then the Strategic Planning Committee update, which was focused on centralized housing location and the open HMIS, as well as a brief update about Homebase as the strategic planning consultant. Please raise your hand and staff will unmute you and alert you when it's your turn to speak.
All right, we have quite a few hands. Jerry, I'm going to go ahead and unmute you.
Yeah, thank you very much. Two pluses and two neutrals recommendations. The pluses, Ty, I sincerely appreciate the report that you did and how understandable it made the voucher process. And that was a very good report. And the other compliment is to all of you. And as having watched this board for as many years as I have, the level of sophistication and nuance and knowledge that you're all showing is notable. Over the years, all of you have worked very hard on various things, but this particular board and the way that the staff is supporting the board right now is a good thing, and I want to thank you for that. On the strategic planning, though, I want to also please add in a relationship with the regional Social Security office. I don't see that in the strategic plan, and I think I've asked for that before, is that as we're doing the income enhancement and helping people to get their paperwork together and all that stuff, I think having a really strong direct relationship with the federal Social Security office in Santa Rosa for expediting our clients' applications, similar to SOAR, or with that same concept of SOAR, is a direction I'd like to see us go. Thank you.
Thank you. Next, Gregory Fearon, I'm going to go ahead and unmute you.
Thank you very much. I know that you guys are getting tired, and so am I, of having to complain about the chaotic well, just chaos among all the different silos in the county. But I want to say again that there was no magic in what we did in Marin. As the guy who started the whole Marin homeless services system 30 years ago, I can't claim any real credit for what it turned out to be, but I can say that it was made a whole lot easier because 20 years before I showed up, they built a health and human services system, which had all of us sitting at the same table all the time. We didn't have to worry about going cross department. It was all in one department and they all showed up when I called the meeting. We had community development and the same meeting at healthcare and same meeting as everywhere else. And so the natural and the community. And so the natural result was we thought about how to build centralization. We thought about how to bring everybody up and share. And I've never seen that happen in Sonoma County. And you have the opportunity. You've had study after study saying you should do something like that. So I want to ask you to set your sights a little higher, not to try to make better out of chaos, but to, once and for all, say you're all on the same page. So tell yourselves that you want to build something that's more than one little program that has some coordination. Not good enough. And I really hope you get inspired by all the successes you're having when you do have the coordination that you have to make necessary and mandated. Thank you.
Thank you. Next, we have Adrienne Lobby. I'm going to go ahead and unmute you.
Thank you very much. I wanted to just speak a little bit about the vouchers, the emergency housing vouchers, because our organization SAVES was involved in that, and echo what Jenny Lynn said about the collaboration level. It was quite extraordinary to be in a room with various agencies and have people say, I'm willing to give up my voucher for someone who needs it more. Just that simple thing it was really extraordinary. And I want to praise everyone who was involved and the staff who coordinated it. It was also a horrific process. And I think in looking back at what we've done so far is that there was a lot of training involved, agency training of personnel. I know we learned a lot about how to get people ready for vouchers, but also the staff of the county. We had numerous trainings that really just confused me. And I think that's really speaks to the training we all needed to go through to get this process going. I hope we get a lot more vouchers, another chunk of them. And I think you'll see a lot of progress made. Thanks a lot.
Thank you. I'm not seeing any other hands at this time.
All right, many thanks, everybody. We'll continue on with our committee updates. I think the rest of them will be relatively brief compared to the first ones. Next is Charter and Policy Review, and that's going to be Aaliyah giving a brief update.
Yeah, I just wanted to provide a very brief update. The Charter and Policy Review Committee completed the revised charter. Thank you, Dawn and Jerry and many other instrumental people in that. So that committee is now on hold until the next revision is required or there's a policy that needs to be reviewed. So that is the update.
Thank you, Aaliyah. Let's see. Next, we've got our Homeless Management Information System / Data Committee, and Daniel Overberry Howland will be giving that update.
Hi, everyone. Just a brief update. So our committee only met once since the last time the board got an update. We reviewed the 2021 HUD system performance measures, which are a set of high-level system-wide metrics to look at our progress year over year. This is something that's due for submission to HUD in late February. We also discussed vacant seats on our committee, and we have some potential replacements lined up pending committee approval. And lastly, we looked at the discussions that are going on around the Hope and HMIS, which you heard from the last committee. I'd like to add to that just briefly. We heard part of the request was dealing with interagency data sharing and whether or not a provider serving a client that had been served by a different provider in the past could reuse previously collected information to minimize the administrative burden as well as reduce the number of questions that a client has to answer prior to receiving services. So this is something that is allowable, and it's not really outlined in our current policies. So it's something that we can definitely continue looking at. That's all I have.
Thank you, Daniel. Do we have any questions for Daniel before we move on? All right, not seeing any. Our next update is from the Lived Experience Advisory and Planning Board, and Andrew Okufu will be providing that update.
So I have exciting news for everybody. So we just had our LEAP voting session last Monday, which was pretty well attended. 20 applications, which we reviewed for 14 lived experience spots. And I am pleased to say that we were finally able to formalize a lived experience and advisory planning board for Sonoma County. So congratulations to everybody who was selected. As you all know, Rebecca, who's on this call, is one of those members. So we are extremely happy and excited about the group of folks who applied as well as who were selected. It was done by majority vote, so it was all by people with lived experience electing those to represent them. And it was great hearing the different stories from different people and the amount of experience and the background which some of these folks have, which they'll be able to apply into contributing to ending homelessness in Sonoma County. So we're extremely happy about that. We'll be hosting our first lived experience and advisory planning meeting on February the 7th. So that'll be next month. We're happy about that. We're gonna just go through the logistics, make sure everybody is on board and we get everything lined up. But it's been quite a bit of planning and a lot of discussion and conversation, but major thanks to everybody who has helped us in putting this together. Aaliyah and Leah were extremely monumental in helping out. And, Michael and Carissa have been amazing as well. So we just want to continue making sure that we're providing the assistance needed for this group to be able to have a major piece in this, and have a say. So, I'm just asking the board to continue to be open to hearing the different concerns from lived experience members, because, they're the ones who've been there, they've seen it, they've done it, and they're representing not just themselves, but people who are still out on the streets. So again, we're extremely excited about this, but the real work is about to begin now. So thank you. And if there are any questions, then I am open to receiving them.
Well, first of all, just congratulations, Andrew, to you and all the staff and all the lived experience prep group members who put in so much work to get this off the ground. It's a huge accomplishment. So congratulations to all of you and thank you for all your guys' efforts. Don.
Yeah, thank you. I've got a question about this group. In February, we need to decide if we consider this group viable and robust enough to be able to select a lived experience person for the next board. I've heard some things that are disconcerting to me, and I'd like to at least raise them and make sure we talk about them in February. But my understanding is that folks with lived experience who work for providers are not allowed to participate in this group or be on the board. Is that true?
Yes, it is, Don. This was a decision which was made by those who are part of the lived experience and advisory planning prep group, and it was a majority vote decision.
Okay, well, one of our values that we have adopted and we've talked about in our strategic plan and in our charter is inclusivity. And I'm bothered that we have a group that is not being inclusive in their selection. And I'm not quite sure what to do about it, but that will be on my mind when we decide in February if this group is the right one to pick somebody from the lived experience seat, or if it's something that we should leave to the general membership. I would assume that when we authorize them to make that decision, that it would be done in a way that reflects the values that we've espoused in our documents, and this is a way to make them real. And so I'm open to hearing the thoughts on that, but I just wanted to raise this in enough time for folks to be prepared to talk about it in February, if not today. Thank you.
Thanks, Don. I recall when that issue came up, there were some emails that went around, and I think inclusivity is obviously a really important value. And also I want to be really respectful of the lived experience advisory planning board's decision and ability to have some self-determination for how they want to constitute their own board, and understand that sometimes people don't always feel as comfortable talking about experiences they've had within the system of care when there's employees of those organizations sitting around the Zoom or the table with them. So I see both sides of that coin, and while it may not be the decision I personally would have made, I do want to call that out and just respect the decision that was made, even if it wasn't the way I necessarily would have voted had I been part of the decision-making process. Jenny Lynn?
Yeah, so I was wondering, and you may not have this, but if you know the makeup of the individuals and like kind of the situations that they're in. One of the things that I know I'm really excited, I guess I'll say first of all, to see that we actually have progress and a potential board coming together. And Rebecca, congratulations for being on there. I think that's great. Continuity of the home Sonoma County work you did. It's fantastic. But one of the things that I know I've advocated for in the past is that we have people at different stages of the process, people who, whereas the system has not worked, I think it's important to have that. And also people who the system has worked, whether it's from the sheltering perspective or the housing perspective or vice versa. And I think having a diversity of perspectives is really important. So we're not overcorrecting for one component or undercorrecting for another. And so I don't know if you have the makeup of kind of like people that, the people with lived experience and kind of what those experiences consisted of. But I think that having a diversity of viewpoints is really important. And I don't know what the selection process was, but hoping that some of that was taken into consideration.
Am I able to respond back to that, or do I have?
Yeah, of course, absolutely.
Yeah, I'm hoping it was a question-ish. It was a little rambling one, but.
Okay, I just wanted to be respectful in case, all the questions had to be asked before I could start answering.
No, please answer.
But yeah, diversity was definitely something that was key within the review of the applications. We had a recruitment committee which sat down and screened the applications, and the ones which were selected to move forward were voted on by the entire lived experience group. So diversity was something which was a major discussion, looking at the areas which these people who are selected are coming from, where they're representing. So we had people from Guerneville, Petaluma, Santa Rosa, just different places throughout the county. Then also looking at like the ethnic makeup, making sure that we have a little bit more diversity within it, because that was a major component for this thing even starting out with Barhai. And then also looking at the different things which people are able to contribute, like some people experience within the legal system, people being homeless with children, just different areas which they're passionate about, which they're able to bring to the table and which they can use to really help people out within this group. So that was something that was definitely a key in the decision-making process. And just going back really quickly to what Dawn mentioned, that was a major topic as far as the service providers go. And there's been a lot of conversation about different work groups even, which would include service providers or people who have lived experience, who have worked for service providers or are currently working for service providers. So there's not meant to be a major exclusion, which is going to be permanent. It's just that this group wants to start out with the people who they feel are right there, who have been going through it, who've been impacted the most, and they want to use that as the group, which will be the advisory committee, and then everything else will just follow after that point. So I know that they're definitely going to be fair within the judging of the nominations, and they definitely want to have the best person represent the lived experience seat. So inclusivity is still a major key as part of it. It's been taken into consideration, but they do ask that the COC board and everybody else just respect the decision-making, because they are their own entity, and we want to support them in any way that we can.
Thank you, Andrew. I'm wondering if people had to apply for the board, if the people that were actually elected and are going to sit on the committee, if those applications could be forwarded to this board, just so we can see who's actually on the committee, other than Rebecca, who we already know, and just have a little bit of understanding about their background, just so we can see as Jane Lynn's talking about, the variety that is on that committee, just so we have an understanding.
Absolutely.
That'd be great.
I did have one more question too, and thank you for that. And I agree, Ben, that's a great idea. That would help, because we want to support too. Like, I want this to be a mutually helpful relationship in a lot of different ways. And that kind of leads me to my second question is, what will be the kind of like and maybe this is not yet to be formed, but what will be some of the chartered work that they want to accomplish? Like, how can we help support it? What's the, like, a linkage here? I know it's kind of an independent body, but there's also connections to this board. And I just want to understand a little bit more, like, where can we be providing support? Where can we be ready to be hearing feedback? Like, you may not have that figured out yet, but I think that might be a good future discussion too for this board, so that, again, we're really clear on roles and expectations and support that one another can provide.
Right. And that's a great question, Jenny Lynn. We will have our first meeting, as I had mentioned, on February the 7th. So that will be the opportunity for this new group. Some of them have been a part of the planning process, others of them have not. So they'll be able to sit down and really start bringing to the table the things which are most important. But what I can say is that the LEAP prep group, before the formation of this official group, were working on immediate emergency items, which included the temporary warming stations, like what Rebecca was talking about, and making sure that people have a place where they can be safe and out of the cold when the weathers and the elements are not conducive. So I know that that has been major, as well as temporary housing, checking in with the hotels and the IMDT department. So those have been major, but there's a lot more things which are on the table. So a lot more to come.
Well, maybe it could be a future discussion once you kind of get through the election and get to getting that personal lived experience on this board. Maybe it could be a future discussion of how we can support one another.
Sounds good. So we've got a few, we're getting a little behind on time and have a couple other agenda items we do need to get to. So I'm going to ask Tom and Nora to be our last questioners, or Tom, if Nora put her hand down, and just if we can make it as quick as possible, please.
Yeah, I'll try, but I'm with Don on this. I'm very concerned if we're process-wise, if we're not even considering people because now all of a sudden they're employed with the service provider. That's a real slippery slope. And were there actually interviews, Andrew, or was it just a paper selection?
Oh, no. So each candidate had an opportunity to come before the entire lived experience group and then speak on their background and their experience and the reason why they felt that they would be the most qualified candidate to represent the lived experience group. So everybody did have an opportunity. Some chose to take it, others didn't. And the ones who didn't, we just went based off of the information which they included on their applications.
Thank you for that. But that is very troubling to me that you're going to exclude someone because of what they're currently are doing versus, again, the diversity of thought. And it sounds like there's 14 folks on this. Yeah, I could see maybe saying we don't want a majority to be with the service provider, but to not allow any is very concerning to me. Thank you.
Yeah, and Rebecca, I know you were heavily involved in this. Would you like to comment?
Yeah, so just a quick comment. We are going to have the opportunity to revisit a number of LEAP members. So 14 is just where we started. As far as not having providers, I think there's a few people and some of them didn't actually make it to the LEAP board. So now I think there's more room, and especially hearing from you guys how you feel about it. I think taking it back to the LEAP and letting them know how important it is to you. And what to echo what Andrew was saying is having the the members who on with voting rights or whatnot for our group doesn't mean that we can't have work groups and have more inclusivity. And for everybody to be comfortable is super important. I know some people had some really terrible experiences with staff members, and so they were just deathly afraid of having them in the same meeting, and afraid of arguments, and also the role of LEAP. I think from my understanding is that we would be helping you guys make recommendations.
Thank you, Rebecca. I appreciate that you guys are trying to create a safe space for the LEAP members. Nora?
Yeah, I was going to put my hand down, but I also feel strongly that having been part of some of these conversations and, that the self-determination of this group is really important. And I think when we're thinking about just globally and not just in this setting, but as systems, right, really trying to lift up the voices of lived experience, self-determination self-determination and self-definition is essential to that. And so I think, more so maybe with this particular population than others, creating a safe, trusting space where people can, just get this work off the ground is going to be really critical to its success. I also think it will be iterative, right? Equity, community-driven work changes over time. We learn more, we create safe spaces. So I also think we don't have to approach this, next month as a static thing that will never change. I think that, what we signal when we support this group is that we value the voices of lived experiences to define their own terms about how they come together and how they operate. And that doesn't, detract from the expertise that they're bringing to the table. I had also just raised my hand because I just wanted to give kudos to Andrew, who has been working so hard to get this off the ground, building new relationships for the county, for the COC, for Andrew himself, for our staff. He's just been consummate professional and really, I think, has lived, the role that he was given, which is, support this group, but don't lead this group to something, to a place we want them to be, help them get where they think that they should be. So I just wanted to thank Andrew because it has been a lot of hard work.
Well said, Nora. And Shine, did you want to say anything? I saw your hand up and then you put it down.
Well, I just wanted to comment, Andrew has been was being on the LEAP committee during the whole exclusion of providers. Me and a few other members were outvoted on that, and then Andrew and the other LEAP members had to do another meeting, and unfortunately we're outvoted again on that. But I just wanted to thank Andrew for allowing us to all talk and being really mindful of everybody else on the LEAP committee. So yeah.
Thanks, Cheyenne. And then Rebecca, you want one final word before we go to public comment?
Yeah, I think it was just also maybe a concern about a conflict of interest as well. Because if we're talking about funding for providers and they have representatives in the room,
Yeah, I could understand you might have to have recusals in that case. All right, we're going to go to public comment again for this item. We're going to take public comment on Charter and Policy Review Committee, which was a very brief update, the HMIS and Data Committee, and then the Lived Experience Advisory and Planning Board. So if anyone from the public would like to make comment on these particular committee updates, please raise your hand and staff will unmute you and alert you when it's your turn to speak.
I am seeing a hand. Oh, it's Ludmilla. Ludmilla, I'll move you over.
Awesome. I'm glad she made it.
Ludmilla, are you there?
Oh. Did she disappear?
I see her. Ludmilla?
Okay, hi. Okay. For some reason, my internet provider decided that today would be a good day to throttle down my internet connection to, I think, 0.01 megabyte at points. Anyways, this has not been working. Anyways, regarding the Lived Experience Committee, my kind of vision on this was that we would have a very inclusive group that would include people who had worked for providers. That would not be a majority. And would not be kind of a top-down thing. But there would be a very important space for people who for people with lived experience only there, and also a group for people to get training and get better at bureaucratic and connection.
Did Ludmilla cut out for everybody?
Yes, I'm gonna stop my video just to help the connection if I can. Anyways, I'm struggling here. Thank you so much, Rebecca, for proxying for me today. I am concerned about the diversity on the board. There were particularly no people that I could see of African American ethnicity who had applied. I would love to see anybody that is interested that could bring more diversity to the board to continue to send their information to Andrew so that he can include them in the email list that goes out as far as the different issues that are going to be discussed. I very much did want to include people who with lived experience of homelessness who work for providers and who have worked for providers in the past as part of that, but I was outvoted. The vote and the vote on that, and Andrew could correct me on this, was, I believe, like 7-5 in favor of excluding people who work as providers. So there is a mix there, and there really is a need for a group, that where people don't have those providers. That people did make it quite clear that there were a significant number of people with lived experience who did need a space separately. My personal feeling is that the board that is advising the COC, should be inclusive. That's my personal and organization feeling. But my understanding is that exclusion just relates to the current lived experience group that was chosen. It does not prevent anybody with provider experience who has lived experience of homelessness from contacting Andrew and being put on our email list. I have to kind of I am going to say that as a board representative, I had reached out to a couple of people who were providers, but because I am going to be retiring from the board soon, like after next month, I really didn't have enough time to kind of get something else going where we could hear those voices as well. I'm going to have to leave it to you to advocate for yourself, and I do hear you loud and clear, and so hopefully I'm going to continue to be a part of this. Thank you very much.
Thank you so much, Ludmilla. I appreciate that. And thanks for joining us today when you could. All right, we'll move on to our next agenda item, which is agenda item number 8, which is our staff report. The first update will be about election plan and timing of elections, and Chris White's going to give that update.
And Andrew, I have some slides for that one. Okay, just a brief update. I know that you all have seen this timeline before. Right now, we're really looking at all COC member applications in order to vote in the 2022 COC board election will be due by February 17th. March 2nd is the date of the special COC membership meeting for board elections. The Lived Experience Advisory Planning Body special meeting to review nominations for the COC board experience election is to be determined. And we have March 3rd, there will be an email sent to all new board members to schedule the 2022 calendar. Next slide. So as you all know, we have 5 seats that are currently open for this elections. As of January 25th, we received 2 nominations for the provider seat, 1 nominations for the licensed healthcare organization, 4 nominations for the at-large, and 1 for the lived experience seat. That number is significantly low. I know yesterday we created a flyer to send out to our providers that was pretty brief and just quick to the point, and we're hoping that our providers can help spread the word and trying to get folks with lived experience to apply. So that flyer was provided yesterday, and as of yesterday, we received a total of 25 COC voting member applications from different organizations to vote in the upcoming elections. So voting, applications are still open. They're open all year round, but we do have a pretty good amount, hoping to get some more folks that applied for the board positions. Next slide. I think that's it. Any questions to the point?
Yeah, Jenny Lynn.
I apologize. I was quickly doing something else, but did we mention the step we're going to take to announce who will be in the appointed seats so people could be informed around, so, okay, good. Yeah, so.
I didn't. So
Okay,
thanks for
good.
bringing that up. It wasn't in my
Thank you.
slide.
Sorry, thank you.
Yeah, so next board meeting, we're gonna have hopefully all of the appointed seats already laid out, and so that way that information can be available for the board as well as for when the elections take place in March. I think we are waiting on two appointed folks to confirm our the appointed list for the COC board.
Thanks, Carissa. Don?
You're on mute.
Still 2021, Don.
Jeez, someday. So I don't mind sharing this public information, particularly because a couple of the new board members, to-be board members, have been on this call, on this meeting, most of it. John Moore from the city of Cotati has been appointed to represent Roanoke Park and Cotati. Madeline Angramonte, city council member from Sonoma, will be the Sonoma representative. And Una Glass from Sebastopol has been appointed by the city council to represent Sebastopol in the West County area.
Fantastic. Thanks for sharing, Don. Supervisor Chrissy?
Just, I expect to be reappointed to this board as well.
Great news. Thanks. Yes, Stephen.
So the North County cities will be deciding here within the month, but I expect to be nominated for that position.
Glad to hear. All right, it looks like all of the board questions. Oh no, I see Wida.
Could you please share the other appointed seats, since I'm new, I don't know what.
We're going to be bringing the list to the board during the next meeting.
Okay.
Yeah, I think that the goal was to have a full list so that both this board and other voters could see who was already being appointed to the board by their, jurisdiction or body that has appointing authority. So that could help inform voters on at-large positions or other positions that are up for a vote.
Yes, thank you.
All right. So I think that means we can move on to the next staff report update. Is that right, Krista? We're good?
Yes, that was it. Thank you.
All right, then we'll go on to the point in time count update, and Michael will be given this update.
Yeah, just a really brief update on this one. Yeah, as folks know, as we let folks know, we did move the homeless count out to February 25th, 2022, as did I think every other Bay Area county did move it to that week as well due to the Omicron surge. So we have another month to prep for the count, and thankfully it looks like things are, knock on wood, starting to plateau. So we'll be in much better position at the end of the month, end of next month in February. And we especially are really still focusing on providers first, although the general volunteer list is out. As folks who were at the meeting last week probably heard from our presentation, we'll be we are asking providers who in all cities and jurisdictions who know the areas best to choose those maps first, so that they can get those covered with some guides. And then we'll be opening it up to all volunteers who've registered after that. So I think we've reached out to, and Krista, correct me if I'm wrong, we have reached out to pretty much all of our major providers, shelter, outreach, et cetera. So we'll have a better understanding of that in about a week before we really start assigning things out to general volunteers.
Thank you, Michael. Any brief questions on point in time count? All right, let's move on to the next staff update, which is shelter bed utilization. And it sounds like Daniel and Michael will be helping provide this update.
Yep, I have a brief look at some data to show you guys. So we've had the requests from this board as well as other groups to have a view of current and past emergency shelter bed utilization. So I'd like to just quickly walk you through what we have right now and the barriers to kind of getting to real-time utilization and free beds in the county shelter system. I'm just going to share my screen and walk you through some of the data that's available on the website. Bear with me just a moment. Okay, can you see my screen? Wonderful. Okay,
yes,
great.
yes.
Yeah.
Okay, so let me see. So this dashboard pulls from two different data sources. The first is HMIS, which is where the client data comes from, or how many clients are being served at any given time. And the second source is the annual housing inventory, which is where our capacity data comes from, or just how many beds we have in total for emergency shelters. I should point out that 90% of our county's emergency shelter beds participate in HMIS, which means that 10% of the beds are not represented here. That 10% is roughly 100 beds, and those are with faith-based providers or their beds dedicated to victims of domestic violence. So neither one of those groups participate in HMIS. So this dashboard here has our capacity in the shelter system as captured by the housing inventory represented in light green. So we can see roughly 740 year-round emergency shelter beds are available in Sonoma County. The darker green represents clients occupying those beds. This chart has a 12-month look back, so you can see over the last year we've been hovering between kind of 50 and 70% utilization, and currently we're about 65%, I think, according to this. You can hover over any point in the chart and get a look at the average utilization date on any given date. The list beneath that chart breaks out utilization rate by specific programs and also displays the type of household served by each program. So you can see whether or not the beds are dedicated to families, individuals, or youth. And then we have averages by household type on the bottom right. All of this data is current and up to date as of this morning. To give you an idea of the barriers we're facing in achieving a true real-time view, the capacity data, so those 740 beds that are pulled from the housing inventory, that's captured annually during the point in time count. So that means that this data here is from January of 2021 and would be updated the next time we do the point in time count next month. And although during a normal year, we wouldn't see a big change in shelter bed numbers, it's not been a normal year. COVID has meant that during the course of the year, we've seen capacity drop due to physical distancing restrictions, as well as outright closures of shelters when outbreaks have occurred. Those temporary changes to capacity are not captured here, so we can be reasonably sure that the actual utilization rate is a little bit higher than we see on this dashboard. And in terms of the actual clients in beds, there can be a lag of up to 4 or 5 days sometimes as providers have that amount of time to enter their data into the system. This is just based on local policy, and although most shelters do enter their data much quicker, usually within a day or two, it's not guaranteed. So that can skew the numbers captured for the last few days as we wait for data to be entered. I think that's all I have to say on it. If you have any questions, I'm happy to.
Thank you so much, Daniel. I just want to call out and emphasize what you said is that the capacity of beds is greatly being overstated right now. And that's why it appears like we're nowhere near 100% utilization of shelter beds. I know people making referrals to shelters are well aware that it's almost impossible to get a shelter bed, even when intakes are not shut down due to COVID outbreaks.
And historically, we've been, pre-March 2020, between 85 and 90%, I think has been a pretty good benchmark of, kind of average capacity.
Yeah.
So you do see the effects COVID's had on the last 2 years.
I just don't want people to look at these percentages of utilization and think that we have all these shelter beds going to waste when there's capacity. I can tell you as someone who works with people trying to get people into shelter beds every day that almost every single bed is taken unless there's an outbreak and intakes are down. So just rest assured, everyone, we're basically close to 95 to 100% utilization, regardless of the percentages you're seeing on the screen. Do we have any other questions for Daniel?
Also, one thing to add to, Ben, is some of these beds are very specific, right? You look at Hearn House, and that's only for veterans, right? Coffee House is only for kids under 18. So, you break it down, and not everything is going to be applicable for our biggest population, which is single adults.
Absolutely. Yes, Supervisor Coursey.
Yeah, I'm sorry, I may have missed this at the beginning, but is this a public facing document? Is this a dashboard that's can you maybe put into the chat the link?
We don't have a chat, but we can send it out to the board tomorrow.
Oh yeah, that's right. No chat.
Yeah, we can get Daniel. Can you prep it and we'll get it out to the board tomorrow?
Absolutely.
Thank you.
All right, cool.
So it sounds like this is a public link that is just linked on the CDC website.
That's
It's on the homeless data page that was created, and there's been a couple other things updated. So that whole section has been revised, and Daniel created this new information here based on board feedback.
That's
I just
wonderful.
wonder if there ought to be a footnote on this, explaining what Ben was just saying and what we know, but a lot of people who might not know when they look at this and wonder, why aren't they using all those beds?
I agree. We could certainly look at that. If there's a place to put it on here, might have to put it on the actual page.
There's an option to add descriptions.
Yeah, there we go.
Great point. Thank you, Supervisor. Any other board questions or comments for Daniel and Michael? All right, I think Daniel, you can stop sharing screen now, and we'll go on to our Built for Zero update from Ty.
Thank you very much. This is just a brief overview of Built for Zero. So Sonoma County has recently started participating in the Built for Zero initiative. Built for Zero is a nationwide movement of more than 90 communities working to measurably and equitably end homelessness. 14 communities have achieved functional zero homelessness using some of their processes. Most of those are for veteran populations, but several communities have also achieved this with chronic homelessness, and a few communities have actually achieved both. So they do have some impressive results. Currently, we are kind of earlier on in the process. I've been working to develop a team of what they call key improvers, folks throughout our system of care who can help move these system improvements forward. Daniel has been reporting monthly data into a dashboard, and if you'd like, we can share that dashboard with you. That shows very fresh information on inflow and outflow into homelessness, newly identified people returning to homelessness. So it's a fresher look at data. We're mapping outreach efforts in the community, and more work on that to come. And then the big thing that I'd like to focus on first with this is just achieving 90% or better participation in HMIS. And that would be among COC funded and non-COC funded homeless service providers. The reason for that is if we can achieve that, then we can reasonably say that we have a comprehensive by names list that captures all the folks experiencing homelessness in our community, which is a vital part of the Built for Zero process. So again, we're early on in this, and we're just trying to share this information that this is going on and that we're very hopeful of these system improvements. And if you have any questions, I'd be happy to take them.
And Margaret?
Yeah, just a quick question about the unsheltered population that does not want to be in HMIS, who, they don't want to go through that process. How do you see us capturing that for by names list? I mean, we have an internal list of people that we know that we're working with in case managing and conferencing, but some of them don't, they're not giving us the permission to put them in.
That's a great question, and I haven't had the chance to ask that question of community solutions. But some workarounds, and it may or may not help, but is folks can be entered in a de-identified manner into HMIS. So hopefully that's presented to them as an option. But I can ask community solutions that, but I don't know how we can capture that at this point.
Just curious, because I know that there are a lot of people in that situation. And so if we're just to be accurate about the statement, if 90% leverage HMIS, we'll have a comprehensive list. That's not necessarily the case. We'll have a comprehensive list of the people who want to be a part of it, but we'll still have a huge subset of unsheltered people potentially not being accounted for in that system of care with the by names list.
Can I just add that we did a lot of work around this after our evaluation of coordinated entry in 2019 in terms of, we were out of the regulations for not allowing folks to be able to access programs and services if they don't want to give their personal information. So there is a process, and I think it's really important. There has been materials created that, they go in with a number, they don't have to give their date of birth. And I think it's all about the providers being able to message that information to them. There's a process to keep their contact information locked and secured outside of the system, but enroll them in the system as a de-identified person so they can have access to the services. So there is a process for that. And I think messaging is huge in terms of being able for clients to understand that so they don't have to provide their personal information.
Carissa, quick question on that, just to follow up with my comment. Is that really helpful to a by names list? I mean, I don't know. I unfortunately have not seen that side of the system. My staff have, but how would we leverage that information in this situation?
So there's a little extra steps involved. Essentially, they're enrolled with a code. And so that organization working with that individual will know who that person is, and they could be listed as the point of contact, and they would have their information, stored in their office as a hard copy and not entered into the computer system. So there is a whole process that is developed. Coordinated entry does it right now, not only for victims of domestic violence or just for folks who don't want to enter their names. There are, some caveats in terms of eligibility needs. If they don't give, they can give as much information as they want or as little information as they want. But if they, don't say, let's say if they don't report that they're working with Sonoma County Behavioral Health, they might miss out on an opportunity for a housing program for that. But if they don't have their name enrolled in the system and it's just a code, it's a little different. So there is a process developed. So maybe that just needs to be resurfaced. We do have messaging around that as well.
Thank you.
Yes, Don?
I'm so thrilled to see that Ty is taking the lead responsibility on this. We've actually been part of the Built for Zero thing for a year or so, and it just hasn't really gone anywhere. And so with Ty taking the lead on it, I'm very enthusiastic about that. I want to thank Alina, and I don't think she's on the call anymore perhaps, but Kaiser, I think, underwrote our participation in this, and thanks to them for doing that. We know how to solve homelessness. Built for Zero has the playbook. We just need to follow it. Doing things like the centralized housing locator, making greater use of vouchers. These are things that other people have done with great success. We don't have to figure it out ourselves. And so to be able to leverage that expertise and put the time in through Ty and then other people, I'm just very optimistic and so grateful that this is moving forward. And you mentioned messaging. I'll tell you, I'm going to a public group, one of our community groups on Tuesday of next week to talk about homelessness. And we are getting beat up right, left, and center about nobody's doing anything. It's not working. You're throwing money at the problem, blah, blah, blah. And now with this, I have hope and confidence to say we are going to be doing something that we know is effective. We know how to solve the problem. We're following the playbook. I think that will give us credibility with the public. And so I just want to really applaud and thank Ty and David, whoever put him in the lead role on this. I'm very hopeful and hope we all can support whatever needs to happen to ride this train to success. Thank you.
Thanks, Don. Appreciate the optimism. All right, we'll move on to our final staff update, which is about the lived experience stipend. Dave will be providing this update.
So just to let everybody know, with the board formed, there are the resources now to give out the gift cards to up to 14 members. And I want to thank Saves and Gregory for helping facilitate that. So we're prepared to support not just our lived experience advisory board, but our youth advisory board. And then the persons who serve from those boards on the COC board will get compensation for their time as well.
Thank you, Dave, for that update. All right, we'll move on to public comment on this agenda item. If anyone from the public would like to comment on the staff report today, please raise your hand and staff will alert you when it's your turn to speak and unmute you.
All right, we do have a hand. Gregory, I am unmuting you.
Thank you. I want to thank Dave for helping to pull this off. There aren't many, the lesson I've learned is there aren't many folks who are ordering this many generic Visa gift cards. Everybody wants a vendor because that's the easiest, but we chose to have it be broadly applied. And so $9,000 worth of Visa cards, according to FedEx, left yesterday in Pennsylvania in a truck, and they're supposed to be here by next Tuesday. And when they get here, I'm bringing them over to your office. I hope your safe is big enough, and we'll and you can use them for a great cause. Thanks a lot.
Thank you.
All right, was that the only hand, Aaliyah?
Yep.
All right, fantastic. We'll move on to our next agenda item, number 9, which is reviewing the agenda for our February 23rd COC board meeting. Should be seeing a draft agenda up on the screen. All right. Do we have any board feedback, suggestions? I see Ludmilla's still a panelist. Oh, she put her hand down. All right, Don.
Yeah, I've got a couple questions. One is, will we have the review of the voting applications here? I presume we need to do that before the March election, and that would be on this agenda.
Yeah, potentially. I think, and I may be mistaken, I thought it was just the chair and vice chair that needed to review them, but did we say in the charter that we need to bring them all to the full board, Don? That's not, just not my recollection.
We brought it back to this board and discussed it with this board and decided that just the chair and vice chair would be reviewing them unless there was an issue, and then it would go to the full board.
Okay.
Yeah, I know when I've had a question, I've asked staff to send them to the charter committee chairs, Don, to weigh in if we were misinterpreting any of the charter language.
Okay, thank you. And then on the HMIS system performance measures, we saw this a year ago, I remember. And I just remember the presentation being very difficult to follow with the way the material was presented. So I hope we can work on that. And I'm wondering if we received comments from HUD on 2020 and 2021. I understand they do provide comments on these reports, and if they've been received, if they could be shared with the board as part of the package for next week, at least the 2021 numbers.
On the system performance measures, Don?
Yes.
They don't, so they don't provide it in the raw data. They would, the only place I would think of that would be in the annual COC NOFA, in the review of some of them. We don't have that for 2021 yet. We could certainly get the it'd be 2019, because there was no official NOFA in 2020, but it wouldn't be every measure, it'd just be some of them. They only provide feedback on a few items.
I would be really interested in seeing feedback on data stuff, and appreciate if you could share that with us. And the other thing I would ask for is if at all possible in the data presentation to include comparisons with national level data, state level data, and then maybe Marin or some other more comparable counties. And I think we just saw in the conversation about the vouchers that it's useful to be able to compare and put data in context. And I'm pretty sure that exists at those levels, but
we actually just did that. Daniel, didn't we already start prepping that? Correct me if I'm wrong. I think you and I were working on that, right?
Yeah, there is a one pager with some charts going back a few years and comparisons to both national and state.
Yeah, that's what I thought.
That exists.
Right on that.
to the extent we can get that for each of the measures, I would at least very much appreciate it. Thank you.
Sure thing.
Thanks, Don. Any other board feedback on the agenda? All right, not seeing any other board hands, we'll move on to public comment. If anyone from the public would like to comment on this agenda item number 9, which is reviewing the agenda for the February 23rd COC board meeting, please raise your hand and staff will unmute you and alert you when it's your turn to speak.
I'm not seeing any hands.
All right, we'll move on to agenda item number 10, which is board member questions and comments. Any board member questions or comments today? Yes, Rebecca.
Okay. I guess just to kind of reiterate what I spoke about during Word on the Street, I'm hoping that Turning Point can be utilized. I don't know who or could staff it. Maybe it'd be a mix of medical and psych and acute rehab. I don't know what the capacity of a Renda Center, if they have staff or funding, but I really hope that that we can step up and and utilize that before it gets bought out is, I have no idea what. And also for setting aside funding for countywide effort for deploying maybe military grade tents for emergency warming and cooling. I know there's been a lot of different kinds of efforts over the years, but it seems to be more like popcorn and pilot programs. And I'm hoping that, the conversation can be started and taken seriously of deploying like a countywide effort for when that happens. And that's all. I think I'll talk to somebody at Burbank Housing and see what they're going to do with Palms. I was a little concerned when I went there, and a lot of people were just asking me for help. And I told them I'm really nobody. I'm just, another community member. So I'll see what I can do.
Thank you, Rebecca. And I see Ludmilla, and Leah, I just need a little advice here. We've got both Rebecca and Ludmilla both as panelists for the same.
Yeah. Yeah, there really should just be one board member.
I have to go anyways. So
Okay.
Ludmilla, it's all you. Thanks, you guys.
Thanks for coming, Rebecca. We appreciate having you here.
Thank you.
Thank you.
Yeah, thank you, Rebecca. For sending me. I could go in public. I was, that's kind of why I held off and was dumped in the public before. Yeah, so I had on the shelter bed utilization update thing. I was curious, what was the snapshot? Was that, what time period were those numbers from? Were they, was it a day? Was it per day or what it was? The other thing is, like, it would make a lot more sense as far as the available beds. If it's showing like 700 something beds available, if that number were reduced, or if there were a reduction, like, or another line that said that, some beds were unavailable, whether it was because of COVID or construction or some other crisis that had happened. I know sometimes, something has had to be closed temporarily, and just so that would give a much better snapshot as far as what's actually available, like in that given unit of time. It doesn't seem like that would be too hard to do because the data is known. So that's just that. Thank you. And on the stipends, the lived experience stipend, I've been unclear on how to qualify for a stipend. I had sent a note to Carissa a month or so ago saying, I actually wouldn't mind getting a stipend, even if it's a minimal one, for my service on the COC board and stuff like that. But I was unclear on the process for claiming it. Anyways, anybody wants to help? I'm terrible about asking for money for myself, but I'm curious process wise. So thank you.
Yeah, of course. I think Dave and Andrew can reach out to you, Ludmilla, about the LEAP stipends and the process for accessing them.
Okay, super.
And I think Daniel isn't on the call any longer, but I believe the shelter bed utilization was looking back 12 months. And I believe Krista mentioned that there is a way to add a description where they could say that, shelter bed utilization is, or not utilization, but capacity is greatly reduced, due to COVID, physically distancing, and they could maybe, I don't know if they can't day by day put what that is in there, obviously in our description, but at least
if you
just
have
put how much lower it is in general.
Yeah, and I understand the concept of why it's lower, but I'm just saying, but it would just be logical to me to have that number be on there. Let's say we had 680 beds available that day because one of the shelters had to go to half capacity because of a COVID issue, or something, they couldn't use, I don't want to cause anybody a whole bunch more booking, but it would just make sense because that is such a big number and that's such a big part of our system of care. Rather than having it be flat at 700 all the time or seven something,
Yeah,
Thank
absolutely.
you.
I think they're going to work on putting a description in there to let people know that the capacity is not
a number would help. Thank you. That's all I have to say.
Yeah, of course. Wida.
So I understand there was some discussion about the recording of public comments. I don't know if we were going to talk about that.
Yeah, do you want us to just kind of reiterate what was said at the last meeting if you weren't present?
Yes, and I don't know if any decisions were made about that.
So I think I can let staff do that. My recollection is that some board members asked that the themes of public comment be captured in the minutes, and that the staff response was that the the staff time to do that might be prohibitive, but I'll let staff address that.
Yeah, it's that, but also that there has been in past meetings when I think minutes did try and record public comment, they felt like things weren't accurately depicted, and it created quite a bit of turmoil around that. So I think that we were just following the practice of, I believe, the Board of Supervisors and moving forward.
And I also believe it had to do with the timestamp, right? They wanted to timestamp each public comment, but our minute taker, Madison, thank you very much for all your work, already puts the timestamp above each agenda item. So it's really easy to just go through and see exactly where that's at. So if they had to break it out and do a timestamp at the beginning and a timestamp at the public comment, it just becomes a lot of extra work. When you can easily access the videos that are online and follow the posted minutes that include the timeframes.
Yeah, well, thank you. I appreciate all the work that staff does on all of this stuff that happens in the background that most of us don't see, and appreciate that you guys are following the conventions of the Board of Supervisors. Are there any other board member questions or comments? All right, not seeing any, we'll go to public comment on this agenda item, which is, of course, board member question and comments. If anyone from the public would like to comment on this agenda item, please raise your hand and staff will unmute you and alert you when it's your turn to speak.
I'm not seeing any hands.
All right, then we'll move on to our final agenda item of the day, and that is public comment on non-agendized items. So if anyone from the public would like to make public comment on something that was not on our agenda today, please raise your hand and staff will unmute you and alert you when it's your turn to speak.
All right, we do have a hand. John Moore, I'm going to go ahead and unmute you.
Thank you, Leah. My name is John Moore, and I am a current Cotati council member representing Rhoda Park and Cotati as one of the appointed representatives. I wanted to shout out to all of you people on the wonderful work that you're doing, and quite a lift that this is, and look forward to what the newest iteration of this particular board will be. I think it'll be exciting, and it sounds like it's going to be much more collaborative than it may have been previously. I do have a couple of quick suggestions, if I may. In following along all afternoon, there are some people that spoke after listening to them that I could kind of figure out what organization they were representing. Many of the folks had like CDC on their names and things like that, but some of the other folks did not. So I had no idea who they were and who they were representing. So I thought that might be a nice little touch on there. And then with all due respect, especially somebody that may be new to this type of board, we have a tendency to use a lot of acronyms. And if you don't know what those acronyms are, you're kind of scrambling to try to figure that out and maybe go offline. So we might want to take that into consideration. And I really look forward to working with you down the road. And I have to quote what my fellow council member said to me when we were doing the appointment with the city. Be careful what you ask for. And it looks like it's a lot of work, and it looks like you guys have a lot of heart involved in that. So I'm looking forward to that.
Thank you. All right, I'm not seeing any other hands.
All right, well, thank you everybody for all your wonderful work today, from all the board members to staff to people from the public. We'll adjourn today's meeting, and our next meeting is going to be February 23rd from 1 to 5. And I know we'll be talking about the upcoming election and a lot of other exciting stuff. So we'll see you all then. Thank you all.
Thanks, everyone.
Thank you.